Good morning, everyone. My name is Laura Worrell, and I'm the Director of the Office of Continuing Professional Development at SIU School of Medicine, and I want to welcome you this morning to the fourth annual Women in Medicine and Science Professional Development Conference. Before we get started with the welcome and introductions, I have just a few housekeeping announcements for you. First, we encourage you to use the computer audio feature of this webinar. If you need to call in, please email our office at ocpd@siumed.edu and let us know your name and the phone number you use to call in so we can match them up. Second, we will have Q&A at the end of each session. If you wish to ask a question, you may type it in the Q&A or chat panels, and the moderator will ask the question on your behalf. To claim CME credit, you'll need to stay connected and watch for a link and a QR code shared at the conclusion of the last session today. You'll be able to claim your credit by scanning the QR code with your phone's camera or by clicking the link posted in the chat at the end of the activity. If you miss either day's code or link, you'll be able to claim credit by following the instructions included in an email that you'll receive next week. Within about a week, look for that email containing a link to the evaluation and to claim your credit if you hadn't done so already. Instructions on how to access your certificate will also be included. Be aware that when you close out of WebEx, there will be a short evaluation that pops up. That isn't anything that we see or that we use. It's just for WebEx and is not part of the conference evaluation. We recommend that you open up the conference agenda that you were sent and just leave that open so that you have quick access to the link for the networking session, the optional networking session, which will be at the end of this morning. It's also a good idea to periodically check the chat box for any instructions or announcements that we will be sharing. And just one final reminder that the program is being recorded. So I will turn it over to Dr. Prakash to get us started.
Thank you so much, Laura. And I would like to warmly welcome all of you to our fourth annual Women in Medicine and Science Professional Development Conference. I see Dr. Cruz, our Dean and Provost, has joined us. Good morning, Dr. Cruz.
Good morning.
Delighted to have you with us as well. I am going to give a brief introduction and welcome, and then I'm going to hand it over to you, Dr. Cruz. I'm going to go ahead and start sharing my screen. Can everybody see my screen?
Yes, we can.
Okay, wonderful. So colleagues, friends, advocates, again, a warm welcome. We are delighted to have you join us for our fourth annual Women in Medicine and Science Professional Development Conference. It's our fourth annual and second virtual conference. We are really excited to kick off another fantastic session. I'll introduce myself. My name is Dr. Vidya Prakash. I'm an infectious diseases physician and also the founder and director of SIU Medicine's Alliance for Women in Medicine and Science. The whirlwind of the last 15 months is hard to capture in just a few words. Our lives have been upended by a formidable virus, forcing us to rapidly change how we work, how we care for our families, and even how we function in society. It also uncovered another pervasive and equally devastating pandemic of racism and oppression. Our television screens ablaze and social media pages inundated with graphic images of crimes against our Black citizens, our family, who suffered gross injustices. Indeed, 2020 was the, quote, year of racial reckoning, end quote, as declared by Dr. Kamara Jones. Amidst the chaos and discussion and upheaval, my observation is that we took a much needed moment. We had honest, often difficult conversations, and this dialogue made us look within, where we faced our own culpability and our own personal roles in both pandemics. And this brings me to what brought us all here today, advocacy and allyship. How do we define those? I can sit here and give you definitions, but what I prefer is that you learn from our amazing array of speakers who are incredibly gifted and talented leaders who define these terms through their actions and through their leadership. My heartfelt thanks to our keynote speakers, Dr. Mira Kodagal, Dr. Larissa Avila Santa, Ms. Nikita Richards, Ms. Kalpana Kodagal, and Dr. Alice Thornton. I'm also grateful to our amazing panelists that you'll be hearing from later today, Mr. Michael Falon, Ms. Erica Austin, Ms. Heather Wetzel, Dr. Tracy Smith, and Dr. Susan Hingle. We wouldn't be here today without who I call the dream team, Dr. Wendy Elamine, Dr. Susan Hingle, Dr. Stacy Satovia, Ms. Laura Worrell, Dr. Vidya Sundaration, and Dr. Hyung Han, who represent our conference planning committee. And without their collective talent and genius, we wouldn't be sitting here today. I would also really like to thank our medical library team, and in particular, Ms. Lydia House, who was able to generate a wonderful AWIMS video that you'll be seeing later this morning. Members of our Office of Continuing Professional Development, including Ms. Jennifer Coyle, Mr. Ronald Wilshusen, and Ms. Barbara Schilau, and from IT, Mr. Benjamin Kirchhoff. Much gratitude to our sponsors. The organizations and department on this list not only contributed this year, but they have contributed over the last several years. And I am especially grateful to them for all of their support. I would like to give a brief overview of AWIMS and what we've been up to over the last year. AWIMS's vision is a strong and meaningful alliance amongst all members of our medical community, working harmoniously in order to support the mission of our institution in an equitable environment. So what have we been up to this last year? Our education subcommittee, headed by Dr. Najwa Perveen and Dr. Robert Robinson, has been going strong. I'm proud to announce that we're going to be launching a special He for She track in the next several months. And we have not been deterred by this pandemic. We have really acclimated to virtual mediums. So we went from in-person sessions to virtual events. And I will say, while it's not quite the same as being in person, the dialogue and the discussions have been just as powerful. Our research arm, led by Dr. Stacy Grundy and Dr. Hyung Han, should be highlighted for our receipt of the American Medical Association's Joan F. Giambalvo Fund for the Advancement of Women, where we were given a grant and we used that grant to give 13 women investigators, faculty members in our institution, resources in order to start their own research projects. And I'm delighted to announce that you'll be hearing from 5 of these awardees tomorrow, who will be talking more about their progress with their research projects. So a lot of good stuff. Community engagement, led by Dr. Nana Cujo and Ms. Patrice Jones. We've continued to help our homeless community members by making meals for them. And during the last year, Ms. Jones especially has been instrumental in mobilizing AWIMS members to help with the pandemic effort, from giving town halls to our SIU community and our community at large on topics ranging from COVID itself to the vaccine, and helping with vaccine and testing sites. Mentorship and career advancement is also going very well, led by Dr. Andrew Wilbur and Dr. Krati Chauhan. We've had several educational sessions on topics ranging from how to be a good mentor to how to make the best of a mentor-mentee relationship to coaching. And we have a central hub with a list of dedicated mentors that anyone from across the institution can access in order to reach out to a prospective mentor. Mindfulness and wellness, led by Dr. Christine Todd and Dr. Betsy Hopkins. I'm very, very proud of this team for bringing to SIU virtual town halls. And these are safe spaces that they have had throughout the last 15 months, inviting our SIU community to come and share their honest thoughts and reflections on how they're navigating the pandemic. And it allows for safe spaces and vulnerability and a lot of healing. It's been very powerful. This brings us to today, our professional development conference. These are pictures from years past where we were in person, which is great. But I will tell you from last year's experience and what I know will be this year's experience, our connection and our dialogue will be just as powerful. Notably, we were one of the Insight into Diversity magazine's Inspiring Affinity Group awardees in 2020. Very excited and delighted about this. And we would be nowhere without all of the executive committee members that I just highlighted and our AWIMS advisory board. Notably, Dr. Wendy Wills-Elamine that you see in the top left corner. She is our Associate Dean for Equity, Diversity, and Inclusion, under which the Alliance for Women in Medicine and Science is housed and continues to thrive. Before I hand it over to Dr. Cruz, I would like to remind you that we will be having a virtual leadership series that will begin in August and go through October. It will occur every other Tuesday evening. The panelists that you will be hearing from later today will be taking a deep dive into each of their areas of expertise, whether it's wellness or mentorship, public health, or advocacy in the community and community health. So please be sure to attend these sessions as well. Without further ado, I'm going to turn it over to one of my favorite he for she allies and advocates, our Dean and Provost, Dr. Jerry Cruz. Dr. Cruz has been the strongest champion for AWIMS from its inception in 2018 to present day. He is always a guiding light. He is a very strong and vocal source of support and encouragement. And I think we're just very lucky to have him in leadership and have him here with us at SIU. So I'm going to stop sharing my screen and I'm going to hand it over to you, Dr. Cruz.
Okay, well, thank you so much, Dr. Prakash. It is great to be here again. The fourth annual Professional Development Conference. It's fantastic. My thanks to AWIMS, to the Office of Equity, Diversity, and Inclusion, and to the Dream Team. That's quite appropriate in this Olympic year that's delayed 1 year, but you know, the Dream Team is really the Dream Team. There's no doubt about that. I think all of you know that this conference has been transformative for our organization. Hearing from our own leaders, hearing from those on the outside brings just a wealth of ideas, a wealth of challenges, and a wealth of encouragement that move us forward. And Dr. Prakash has already shown you all of, well, not all, not even remotely all, but examples of some of the programs and things that have been done, the awards that have recognized the good work. Those things are all great. But you know, one thing I recognized in a conversation yesterday, I had a talk with Dr. John Mellinger of the Center for Human and Organizational Potential, talking about excellence and how in this organization at SIU Medicine, what he and others were doing for that was actually changing the culture. And you can talk to Dr. Wendy Wills-Elamine as well, and the culture for racism and becoming an anti-racist organization is moving. It's hard to measure. It's slow. Sometimes you have to just look back and say, how were we 2 years ago? But the same certainly can be said for what's happening with this conference and what's happening with AWIMS. The biggest and most important thing to me and for the organization is that the culture is changing. Now, in our strategic plan, we have 5 values, and we were very careful about picking a small number of values that are very important to us: discovery, excellence, collaboration, compassion, and equity. And today, you're talking about allyship and advocacy. The topics, the speakers are great. I can see that this conference will help us influence the community and become a leader, and that's a true mark of culture change. And so in the value of equity, that's the place where we commit to becoming an anti-racist organization. But a statement in that value proposition is that we strive for relationships and strive for equity in relationships, hiring practices, teaching, research, access to care, delivery of care, and partnerships. Again, the first one was equity in relationships. And so as we've moved through the pandemic and we've learned how to be in contact in many different ways now, but real contact, listening, learning from each other, that's what's happening today. And so again, thank you so much for putting this together. Thanks for the great lineup of speakers, and thanks for the exchange of dialogue and ideas that's going to make us better. I really appreciate it. So I wish all you the best during this conference. I think it's going to be great. Thanks.
Thank you so much, Dean Cruz. Thank you so much for your words of encouragement and your ongoing support. I do want to underscore again your leadership and how you really model the best type of leadership that makes organizations like AWIMS and conferences like this possible. So we wouldn't be here without you. So many thanks to you, much gratitude to you for all you do and for all of your advocacy and for modeling it so well.
My great pleasure. Thank you.
Okay, I am going to share my screen again to introduce our speaker. It is a great honor and a privilege to present our speaker, Dr. Alice Thornton. Dr. Alice Thornton completed her medical degree at Marshall University in Huntington, West Virginia. She completed her residency at Wake Forest University School of Medicine in internal medicine, after which she completed her fellowship training with the Division of Infectious Diseases at Indiana University, Purdue University, or IUPUI, where she studied the pathogenesis of chancroid. She was recruited to assist in the development of an infectious diseases program at the University of Kentucky in 1998. Dr. Thornton has successfully acquired 4 HRSA, or Health Resources and Service Administration funded grants, the Ryan White Part B, C, and D, and the Local Performance Site Grant of the Southeast AIDS Training and Education Center. She is PI of the NIH-funded REPRIEVE study, or randomized clinical trial to prevent vascular events in HIV. Dr. Thornton is a clinical site visitor for HRSA and also serves as a grant reviewer for NIH and the CDC. Dr. Thornton has served as the medical director for the Bluegrass Care Clinic and has also served on the HIV MA Board of Directors. She is a professor of medicine in the University of Kentucky Department of Internal Medicine and chief of the UK Division of Infectious Diseases. Dr. Thornton, it is an honor and a privilege to welcome you here. I'm going to stop sharing my screen so you can share yours. Warm welcome.
Thank you so much, Vidya. And the other Vidya, who was my fellow at the University of Kentucky. Thank you, everybody. And again, thank you, Dr. Prakash and Dr. Sundarishan, for allowing me to be part of this. And I definitely agree with the Dean and you, Vidya, that this has definitely been a year of advocacy in almost every level. And I'll try not to get emotional, but every time I think about COVID this year, I get sort of teary-eyed. So forgive me if I get like that. So, but,
well, you and me both.
It's been a rough year, hasn't it? And I sort of forget how rough it's been until we get in situations like this when we start talking, and then it's just it just happens. So if I get teary-eyed, please ignore me. It's just a residual of COVID. All right. Well, I think we're ready. If that's okay with you, Vidya.
Yeah, please.
All right. So we'll go ahead and start with the next slide. So you can see my objectives here, and I tried to come up with objectives from some of the literature that I could find. And so for us, more importantly, for those of us that are out here that are medical providers, I think it's important to think about what does that mean to be a medical provider advocate? And then what are the components of advocacy? We always come up with reasons why we can't do different things. And so what are some of the barriers to advocacy? And then developing strategies to become a stronger or a strong advocate. So what is advocacy? And wherever you look, if you Google, look it up in a dictionary, wherever you look, you're going to find different definitions. But one definition that I think is that rang true for me was a person who publicly supports or recommends a particular cause or policy. And that's probably close to where this could be. but I also think we help people find their voice. And that may be our patients, that may be other providers, that may even be our family members. So we find ourselves in those situations where we're helping ourselves find our voice and we're helping other people find their voice. We think about advocacy being in three types. There's self-advocacy, which I think that's a point where we all have to get, I think, before we can be advocates for others. And you may not even realize that you've gone into that role for yourself. When I was reflecting on this topic that Dr. Sundareshan asked me to talk about, I started out with thinking, well, am I an advocate? How did I become an advocate? And it actually helped me be more aware of how I got here. So I think that's important to recognize your own self-advocacy. And then individual advocacy. And I think that we find ourselves in this situation every day in our clinics, in our hospitals, with lots of people. And I think with our children, sometimes we found ourselves in those situations. As I was reflecting, I thought about situations with one of my oldest son, ways that I had to advocate for him when he was in elementary school. And so that can be formal or informal, but we can find ourselves in those situations. And then system advocacy, and this is often reflected when we join a collective group, or maybe we strike out on our own, in our own hospitals, in our memberships that we're part of, or boards, or even in political arenas where we're trying to change policies or laws or rules that not only impact our lives, but the lives of others. And I think the opening remarks really touched on some of that, where we found ourselves this past year. All right, so it looks like in early 2000, maybe 2006, we started seeing organizations, both the Medical American Society and then various Canadian medical societies, talk about what role do physicians have? What is our responsibility? What is it to be a professional? And what responsibility is there to be an advocate? And not surprising, our Canadian friends who have socialized medicine have really come out stronger on this. But the American Medical Association and other associations have also, particularly pediatric associations, seem to be really strong about this. So the American Medical Association, they have a whole section on this, so you're welcome to go to their website and look. But one particular sentence I think sums it up pretty well. An advocate for the social, economic, educational, and political changes that ameliorate suffering and contribute to human well-being. And surely all of us must have come into medicine because we wanted to help people suffering in some way. And so I think that really does get to the heart of it. If you look at our Canadian friends, there's actually it's a little more explanatory, I think, if you look at some of their websites. But physicians contribute their expertise and their influence. And I think those are two really good words when it comes to advocacy, as they work with communities or patient populations to improve health. They work with those they serve to determine and understand needs, speak on behalf of others when required, and support the mobilization of resources to affect change. And so I think that as an advocate, definitely your influence is important, but also that change. When I began my career, we often heard the words change agent. That's not a word I hear so much more now, but I was thinking about that this morning. And so I think with advocacy comes the ability and the willingness to try to affect change for other people and ourselves. So this was a very nice paper. And this is from, again, our Canadian friends. I think it was forget which city, but anyway, it was a university, and they looked at 15 advocates that they had their members of their team recommend for them to interview. And these were in-depth interviews with folks. And they asked them several questions, and then they came with themes. And I think this really, I felt like this really got to the heart of where I'm seeing that we are today, at least in my life. And also, even if you're at the beginning of your career or at the beginning of your advocacy, maybe you're at the later years of your career, and you've never really delved into advocacy, you could definitely look at these stages. And so they talked about development of health advocate identity. They talked about facilitators of health advocacy. So who facilitates this happening? And then they talk about your role of a lifelong advocate. So I thought these were really good. and just to go over the themes just a little bit more. And I've sort of centered my talk around these themes. Who am I? How did I get here? You know, how did I become an advocate? Am I an advocate? You know, what were the early influences? And I think this is really important if we want to try to pass on advocacy to those that are coming after us, is knowing how one becomes an advocate and what encourages us to look at this. It can often be exposure to social injustice. This was one of the physicians talked about a grandparent that was in Jewish concentration camps. And so I thought that was really interesting. Maybe in the formative years, being allowed to travel either undergraduate or in professional schools to another country, or people that might be less fortunate, and looking at what that's like there and learning some things about that. And once you sort of step into the path of advocacy, once you've been inspired, what does that look like? I think having mentors is really important. And I thought about my mentors today, and I'll share that with you. Training, education, and work experience is also very important. And then one thing I think is, and I think this organization having this conference today is a very good example of that, is systemic organizations can support advocacy and help people have a collective voice. And I think that makes it much easier. And how do you continue once you're down that route? Do you just get to a point and you just quit? Well, we hope not. We hope that you continue to learn and improve, and then have self-reflective moments. And I must say, giving this presentation has helped me really do a lot of self-reflecting over the last few weeks. And then just enjoying it, enjoying what you're doing, and enjoying being an advocate. I like being around people, and I like talking about what I do. And you have a voice when you do that. So this is moving into the identity. So I'm going to kind of use myself as an example to prove and discuss some of these points. So we all grow up somewhere. We all have a story, right? And so my story is I grew up in the early 60s was when I was born in West Virginia, in a southern West Virginia, in a coal town, not probably too uncommon to some of the areas there in Illinois. I was a daughter of a union coal miner. And I must say that the union part of that probably informed me more than I knew at the time, and have really just become aware of how much my dad probably influenced me without me even realizing it. He only had a 5th grade education. He was a coal miner for 33 or 35 years. But one thing he always did, which I think was really important for me, was he always watched the news. And back then, there was like, for us, we had one station that we got. We didn't have lots of different options in our little mountain town there. But he always watched the news. You weren't allowed to talk when he was listening, and he always read the newspaper. So even though he was not a very educated man, he tried to make sure he was educated on what was going on around him, which I think is really important. I was the youngest of 7, so I quickly learned how to navigate other people, which is probably a good skill in life, although most of them were gone by the time my brother and I were growing up. And I grew up in a time where there were little girls and there were little boys, right? Things were very distinct. We had different interests, and you were treated differently, right? As a little girl versus a little boy. And one of the things in my community, and being Appalachian, if you're Appalachian, and maybe this is in other communities, is those little boys and little girls were called Bubby, and the little girls were called Sissy. And in reflecting for this talk, I think this was my first self-advocacy that I did. And I didn't even remember how old I was, but I remember conversations with adults when they would call me Sissy, and I would say, that is not my name. My name is not Sissy. I don't really like my name, Alice, but it's definitely better than being called Sissy. And so that was sort of the beginning, I think, of my advocacy for myself, was making sure people knew my name. So my next, I think, moment for me that I think has really informed who I am to be a medical advocate for others is another time in my life, which was a big time, where I had my own health crisis, and I was on the other side of the fence. And I didn't really like being on that other side very much, to be honest with you. It's much safer being the physician in control than it is being the patient. And I found myself hospitalized for several weeks. I was pregnant at the time and ultimately diagnosed with ulcerative colitis. But at the time, I really had a hard path just to get into medical care. The program that I was employed by had an HMO, and I didn't know much about HMOs, but you can't go outside the system, and you have to see the doctors that you're assigned to or that are part of that. And unfortunately, they didn't have a lot of GI doctors, and I was trying to get help. And the appointments that were made for me were like 6 to 8 weeks in advance. I was pregnant. 6 to 8 weeks is a lifetime when you're pregnant. And so I just kept getting sicker and sicker. And long story short, I ended up having my son quite early at 32, 33 weeks. He ended up being in the ICU. I was quite sick in the hospital. But the person that took care of me, he was out of the plan because he was my access in the hospital. And after I got better and I was back to being a resident, I got a call one day. My son was about 3 months old. And it was a representative from the HMO. And they said, you can no longer see, I think it's okay to say his name, Dr. Fina. And I said, why is that? And they said, he's not in the HMO. And I said, well, the HMO really didn't have a provider that could see me. And I got sicker and sicker. So I want to stick with Dr. Fina. And there was back and forth discussion. And finally, I just got this idea in my head. And I said, well, if you don't want me to see him, and back then we didn't have internet, I said, I'm going to call the newspaper and I'm going to ask them for an interview. And I'm going to tell them my story and what a horrendous time I had. Or I can not call them and you can just let me continue seeing Dr. Fina. I only have 3 months left. Let's do that. Well, it wasn't very hopeful when I hung up with the call, but I got a call back later in the week and they said, you can see Dr. Fina. And I was shocked that someone actually did what I suggested. And that it was a win. And so it was a win that I haven't forgotten. And so that was the beginning, my own crisis of trying to be an advocate for other patients. And so what does our advocacy look like? Who does it touch? Well, it may be local, state, national. It could be coalition building, and that's an example I'm going to give you in a moment. It could be board membership. Don't underplay your value in being a board member. Influence policymakers. They want to hear from you. You are an expert. I think about the pediatrician in Flint, Michigan, and the influence that she had as being a leader in injury prevention. Of course, she was trying to prevent further injury because the injury was already done. But I think she's an excellent example of an advocate that wasn't always welcome, right? Her voice wasn't necessarily wanted to be heard by people. We can be a liaison to media. I think about, I'm forgetting his name, the neurosurgeon, Dr. Gupta, who's, I think, a wonderful advocate for patients in talking and educating the public. There can be reallocation of resources and then quality improvement. I think about my colleague, the nurse practitioner, Tiffany, that I work with. She strives daily to try to increase our improvement by looking at our surveillance and our quality improvement. So what are the components? Again, we are uniquely positioned as providers. We can often look at the links. How did this person get to my office today? What were the social determinants or factors that led them to where they are? We do generally have public trust, maybe not as a group sometimes, but people typically trust their physician, and that single physician has a lot of influence. As we've already mentioned, that we usually can get access to policymakers and local and national leaders that other people might not be able to get. We can influence the public, and we can ground our advocacy in our professional experience or our work life. We don't have to leave our jobs to be an advocate. I think we've talked about some of this just quickly. One of the things that we have to think about is what are we trying to change? What is it that we've seen that we think needs to change? And so there needs to be a challenge maybe, or something that you're going to take up and think about. We need to define the issue and what's the scope of that issue. We really need partners. It's hard to go at this alone. And we're used to being advocating alone when we advocate for our patients often, but it works much better if you can engage partners to go along with you. We have to develop a strategic plan. Where do you want to go? What's your ask? Where are you going with this? And then we have to communicate an effective message. And so my example that I wanted to share with you happened in 2006. Remember, that's when I told you it seems like advocacy, medical advocacy started to be talked about a little bit more. And I had heard a story on public radio, and it was actually my colleague, Dr. Sag, and I think I emailed a response into the public radio, and somehow I think he got in contact with me. But anyway, we all started talking, these folks that I've listed here, about some of the things that was going on in the Ryan White funding nationally that we were very concerned about. And so at a national meeting, those of us that were involved, we partnered with a bigger group, which was the HIVMA, and then the American Academy of HIV Medicine, and they sponsored us. And we had a meeting. Next slide. And what we found was that there was bunches of people that wanted to talk about this. It was standing room only. And we were just floored that so many people were feeling exactly what we were feeling at the time. And so that was the beginning, just a room full of people. And we started a group of us that would be the founders, and then we met monthly. And then we started down a path of advocacy that has continued until now, 2021. We actually went through Zoom calls in April, which is a yearly thing that we do. Usually not Zoom, we actually usually go to Washington, D.C. But this was the beginning. And it started by someone seeing an injustice, the lack of funding, the lack of a voice for providers. Big Pharma, it seemed, was speaking for folks that manufactured HIV drugs, but nobody was speaking for the providers, we didn't think, and we wanted to have a voice. So that was our beginning. We now have 446 members, and I think that we are represent 47 states, and that's the Ryan White Providers Medical Coalition. This is just some of the things that we've done. One of the things that's really important, I think, for advocates is to build strong relationships with those that you're trying to influence, right? And so we were trying to influence congressmen and senators and people in Washington. And so we had some lovely people that we've worked with, I think, almost the entire time. Jenny Collier, who is a lawyer by trade, and Andrea Weddle from the HIVMA and IDSA, who's actually is a trained social worker. So what better person to help us with organizing ourselves? And so almost every endeavor that we've done is we had training first. We would meet with either Jenny or others that they would bring in. We did a lot of telephone calls. We do monthly calls, but a lot of those trainings even happened over telephone. We didn't do Zoom then. And then a lot of in person. And then we started going. We started going to Washington, D.C., and they encouraged us to go to our own state's capitals. So we had congressional testimonies, congressional briefings we could be part of. We invited our local and our state and even national folks to come to our clinics. Look what this public funding, look what this Ryan White funding is doing for these lives of patients. And what we found is actually our voices were welcome. They hadn't heard from providers before. They had heard from large pharmaceutical companies and maybe patients, but they hadn't heard from providers. And so we got to have input in developing a national HIV/AIDS strategy. We got to work with the president's AIDS, I'm forgetting what PATCHA stands for now, but anyway, it's a presidential selection of providers that speak about HIV and AIDS. And by having a coalition, we got to have a direct line of communication to other providers and learning what other providers were struggling with that maybe we didn't know about. And we try to always have at least one national meeting. Next slide. Those are some of my colleagues at one of our times in Washington, D.C. And we've actually achieved a lot. One of the things that I was reminded of, that if you have Ryan White funding, you're familiar with this right now. So we just had to turn in some of us had to turn in our competitive Part C grants. And used to be, this was it's still long, but it was even longer. And so we advocated for there to be a limit and cut down on the number of pages this grant was. And because it was just for busy clinicians trying to write these grants, it was just impossible. And so that was one of our big things that we did. We also were faced with we also were faced with looking at budget cuts. And so we advocated to continue Part C funding. And we explained to them and them being congressmen and senators, what this would mean if there were continued funding cuts at a time when HIV only continued in the numbers, and to have our funding cut would be disastrous. And so we pointed that out. There was a ban on federal funding for syringe access programs. And we actually joined advocacy with that group and talked to folks about let us start looking at getting syringe access into communities. And so I felt like we were instrumental in educating a lot of people about that. We can go ahead to the next one. Oh, one very important thing was with the ACA implementation with Medicaid expansion. We did a lot of time with congressmen and with senators, and many of us had opportunities to talk to groups about, what that looks like. Kentucky was very successful with their Medicaid expansion, and I had lots of opportunities to share our success stories. And these are more, and this was a significant picture, I think, because it represents about 3 generations of advocacy. So you can see my friend Judith there, Judith Feinberg, who is a wonderful advocate and has been at this a while. And then you can see to the left our colleague, who's a pediatrician, and then Dr. Leedy, Nicole Leedy, who was one of my fellows, and now she's a colleague, and then the pediatric ID fellow with the pediatrician, which I think is wonderful. So I think this is, an example of that collectiveness and also training others. And I'm going to not spend as much time here, but this is just pointing out the things I've gotten to do being part of this large advocacy group, which started out to be a very small advocacy group. But some of the things that I was taught by those mentors, Andrea and Jenny, is that we're viewed as responsible and knowledgeable and an expert. And we are. We often downplay that, I think, particularly women. But we are, and we should acknowledge that role and be proud of it. Our communities that we are part of, the institutions, the universities or the health centers, they're very important parts of the community. We are used to having to take complex information and share it with patients. And so we can take complex information and share that with lawmakers and other people that make decisions for our patients and for our community and for ourselves. We are influential. We forget about that. We do have influence, and we should hang on to that and be proud of it and use it. And I've already shared with you some of our successes. And this was just a slide that I borrowed from our advocacy group that was just encouraging our members, call or email your members of Congress. But I think that's something you can do. If you're someone and you're like, it's just not my gig to go and sit down with someone, that just doesn't feel natural, you can call. It's if you have your senator or congressman's number, most of the time it's just a voicemail. You don't even have to talk to people. If you're more of I don't want to talk to somebody, I'm more of an email person, that's a great way to do. And it could be your mayor, it could be your dean, whomever. You can use your voice to point out things that you've observed. It doesn't have to be confrontational. It can be, hey, I just ran into this challenge and I wondered if you've noticed it as well. If you have the opportunity, though, it's great to visit your district or your capital, or maybe your mayor's office or DC offices. And it's much easier to do that as a group. I will say that. You can invite other people to come to your clinic, invite your mayor, invite, whomever, invite your dean. Hey, come and see the great things that we're doing. Come and see what we're doing in the hospital. Come to my research lab and see the amazing things that we're doing. And you can request support. Mine was from the Rhine-White Members Providers Coalition, but you could Medical Providers Coalition, but you could also look for other people. Maybe it's the AMA, maybe it's this organization, the Women in Medicine and Science. Look to who are your allies and who you're part of, and see if they have advocacy training and advocacy that you can join. And this is just some of our wonderful friends that have been part of this. So why do people not be advocates? What holds us back? Well, we've been busy. We've been part of this very laborious medical training that takes a long time. It's intense. It's isolating. We spend a lot of time studying before we even get to see our first patient. And it removes us from the community. Sometimes, maybe we were part of the community, but once you've been through medical school, you've spent a lot of time by yourself and you're in a sort of a closed environment, right? And so that's not necessarily conducive to being an advocate. The whole selection process of training, we may not necessarily look at people that are more service oriented. We might want people that can ace a chemistry exam. I'm not saying that you can't ace a chemistry exam and be service oriented, but sometimes they're a little different, right? And so that can be different. We like to have control. As providers and physicians, we like to have a plan, we like to have control, and doing advocacy is a little bit ambiguous. What does that mean? What are you asking me to do? Am I going to have to change my job? Am I going to have to change what I'm doing? So we don't like that. We like to know things ahead of time. We're busy. Our lives are demanding. We don't have a lot of time. We think our patients' lives are most important, but the time that you submit to advocacy, if you could just devote a small amount of time, maybe it's just one day a year, whatever it is, then that is a great investment, right? Let me see if there's anything else. Also, we're concerned about sharing our opinions. We feel that we represent a medical community and not just Alice. So, we're concerned about that. We don't want to step on people's toes that employ us, our university, our medical community. And so we're a little concerned about that. And sometimes there's a conflict between an advocacy's agenda and maybe the agenda of those that we work for. And sometimes we're concerned about political fallout. Okay, so we talked about this a little bit, so I'm not going to go through this again, but this is, again, finding out what is at hand, what is your ask. That's really important. And anytime we go to Washington, D.C., Jenny, our mentor, always says, what's your ask this time, One of the things that I've learned from the group of people that have mentored me is to be thankful and to be gracious and respectful. As physicians, a lot of times we're barking off orders to other people. We're used to telling people things and it happens. And with advocacy, it's a little more nuanced. We need to thank people for their time. They haven't paid to come and see us. We're infringing upon their time. And that was a great lesson for me. I've always thought of myself as polite, but I don't think I was very polite. And I think Jenny has really helped me to be better about that, to thanking people for their time and for letting me share my ideas with them. You might be surprised who you can work with. In my situation in the state of Kentucky, I have found myself that I'm often going to people's offices who are on the different side of the aisle that I'm on. Politically. And you know what? It hasn't been so bad. I've been surprised at how gracious and how much they've welcomed me. Now, I've not gone in and said, these are my political views. I've tried to very much keep it polite and keep at why I'm there. So they may not even know what kind of person I am politically. But it amazes me at if you have that spirit of willingness, you can actually work with people, which makes it a much better place, right? And one of my favorite things that I always like to tell my team, which, I hope I do have a Bible major, and so I realize that maybe I'm taking this out of context, but there's a scripture that says, you have not because you ask not. And I've taken a lot of liberty with that quote. So when I tell my team, I'm saying, ask, just ask. All they can say, what's the worst they can say? No. If you don't ask, they've already said no anyway. And so, be a little bold, ask, have asks, even within your own organization, within your own division, within your own department. It surprises me what people will actually say yes to sometimes. So be bold, give it an ask. This is Vidya, in case those of you that don't know her, keep going. And so now we're going to move to lifelong advocacy. And some of this some of the examples that I have, I think could be in the second phase as well with the mentoring and being part of a coalition. But I think some of our lifelong advocacy is to make sure that we're sharing that with other people. Service learning. This is a term that I saw quite a bit when I was reading about advocacy. And this is an example of an undergraduate who happens to be my son. And we were out looking at colleges, and it just happened to coincide with when we go to the Hill each year. And so I invited him and got permission, and he went with us, and he went to Congressman and Senator's office, and it was a great experience for him. He's now a medical student, and I'm happy to say at the University of Louisville. They had a white coats with the trying to think of the exact word, white coats for Black Lives Matter, or maybe I forget what the actual name of the group was. But anyway, he was part of that. And one of my colleagues from years past sent me this picture of him. But I thought that was great that they had the students and invited colleagues to come and be part of that movement. And also part of service learning, down at the bottom, the very bottom there, is my HIV Fellow, Evelyn Villacorta. And so since we were doing advocacy this year via Zoom, I thought, well, this will be a great opportunity to invite our HIV Fellow to be part of this. She doesn't have to travel to Washington, D.C. We don't have to get funding, et cetera, et cetera. And so I invited her. And one of her favorite parts was the prep that we did with Jenny and Andrea the night before. We go through about a 2-hour debrief on what we're going to do, not debrief, but brief on what we're going to do. They have lots and lots of planning ahead of time where people match up. They have folks that go we went into the Zoom room, or if it was live, you would go into the offices together. And it was great. So anyway, Evelyn got to be part of that. And she told me later, she was like, this is great, hearing all these people talk ahead of time about this. And I hadn't even thought about the prep session being meaningful for her. So that was really great for me to hear that. And then we actually did the Zooms together, she and I, and other people were sometimes part of our Zoom meetings with their congressmen or senators. And then we had a debrief, and then we all talked about what was their experience, how did it go, what should we do different the next time, and this sort of thing. And so that was awesome for Evelyn to be part of that. And modeling. And so this is an example of one of my friends, Michelle Ogle. She was in North Carolina. She's now in New York. She's a pediatric ID doctor, and she spends a lot of times with adolescents. And I think Michelle is a fantastic advocate. She really is good about listening to her constituents, who are adolescents and young adults, and then bringing forth their concerns. And also, she is an African-American female who is a physician, and she modeled how the rest of us should be behaving about some of the Black Lives Matter as professionals. And so I loved this picture that she sent to me, and I saved it and used it for this. So here is Michelle modeling that advocacy and being part of her community. And this is a physician assistant student that we've had working with us this year. And so I was telling him about this talk, and I'm like, gosh, I wish I had a picture of voting. I thought I had a picture of me voting. And he's like, oh, I have a picture of me voting. And I'm like, give it to me. So this is my PA, Brent, showing that he went and voted. And I was really disturbed by an article that I read. And I hope that this article is now old and is not relevant, but I don't know. I've not seen any new information. But back in 2007, and this was folks in Philadelphia, they looked at a cross-section of people who voted. And this was 350,870 people. And of that large group, there were 1,274 physicians, 1,886 lawyers. And then they did a multivariate analysis. And what they found, which I just thought was heartbreaking, and they looked at 4 sessions of voting, 4 years. And what they found that physicians were less likely to vote than the general population in 3 of the 4 years that they looked at. The lawyers, on the other hand, that was their comparison group that they looked at that were professionals, had higher rates than the general population. So that I want to encourage us as our lifelong advocacy, not to give away that easy piece of advocacy that you can have to make sure that you vote. Next slide. And that could be in your own hospitals, you know, your not board of directors, but the folks that that are part of committees. We often are called upon to vote. So don't let that opportunity pass you by. And I had the opportunity to share some of what I've learned from the coalition. And so I'm forgetting what year this was. This was in 2017. And so one of our congressmen was having a town hall. And so I contacted my mentors and I said, I want to be part of this town hall. I want to ask a question. I want to be there and be part of it. And so they said, get there early, get someone to tape you. So have someone with their phone filming your question, and then afterwards post it on social media. And so my question was a medical question about, at the time in our state, people were talking about just trashing and getting rid of our Medicaid expansion. And so part of the question I wanted to ask the congressman was, you know, about this. And I wanted to share my experience and how important Medicaid expansion had been for my patients. And so I got there early. I jumped up with my hand. I set up really close. So I got chosen and my colleague taped me. And then we posted it on social media. And then I was someone that saw me there and saw it on social media contacted me and said, hey, there's a meet and greet for providers. You ought to think about, for physicians, you ought to register and come and be part of that. And I thought, well, heck, I'm not just going to go by myself. I'm going to bring some friends. And so I contacted my mentors again and I said, how do I do this? And so they said, well, contact your friends and then we'll help you, you know, have a meeting ahead of time and talk about what you guys are going to say if you get FaceTime with the senator. And they even told me how to maneuver getting, so I did not spend time when we got, not senator, but the congressman, I didn't spend time trying to share my voice. That time I acted like a moderator, like Andrea and Jenny often did. And I kept pushing my colleagues. There were like 10, 15 of us. I can't remember now how many, but at this dinner event when we had actually we got there early and we got to talk to the congressman ahead of time, and I just kept introducing him and his person that worked with him, one right after another, to my colleagues. There were surgeons there were allergists, there were hospitalists, there were critical care doctors, and they were talking about how important insurance had been for their patients. So it was a huge success, and it was really a lot of fun to organize that, and so we came out winners, I think. So some of the things that we can think about is training others, modeling that behavior, as we talked about. Important for trainees to learn about the world beyond the clinical encounter. And as Evelyn said to me, it was so great to see what's the story behind the actual patient that we're seeing. What's the story behind those grants? What's the story behind the scenes, right? It's important to develop interpersonal and leadership skills needed to work in collaborative groups. And again, emphasizing that collaborative group. If you can be part of a group, that makes it so much easier. You're not alone. Invite policymakers to come and visit you. First, do get permission from your organization. Don't go rogue and invite people without their permission because they want to know. Be part of your community and vote. Tell your unique story. What is your story? Tell your patient's stories. You don't have to use their names, but if there's been a horrendous thing, and I told you the example of me as a patient, share those kind of stories with people that are at the table making those decisions. And don't forget to return to your group that you are advocating from time to time, and make sure that your priorities are aligning with their priorities. Make sure you keep in touch with who you're advocating for. Have a sense of humility and trust, and listen and understand with what they're saying to you, and gain their trust, hopefully. And I think that's my last slide. Can we just go one more? Yes. Okay. And you can, if you can go backwards to the conclusion again. All right. Well, thank you so much for listening so patiently. Of course, you were sort of you didn't have a choice, right? I guess you could have started doing email, but thank you so much for listening to me, and I will let Vidya see if we have any questions.
Thank you so much for such a thought-provoking and phenomenal talk, Dr. Thornton. You have given us a lot of food for thought. I would like to invite all of our participants to use the chat function to put in any questions that you have. I do have a couple of comments in the chat, Dr. Thornton. So one individual wrote, I love that. If you don't ask, they've already said no. So very powerful. There's a thank you for your time. I have a couple of comments. So first, I wanted to comment on, just thanking you for sharing your vulnerability, and for, drawing us in to your very personal journey of advocacy. I really wanted to highlight something that you said, which is that oftentimes it's through our own pain, and our own painful journeys and experiences that propel us towards advocacy work. And I think these last 15 months in particular are ripe for those opportunities, just
So
with
true.
between the dual pandemics, right? The pandemic of COVID-19 and that of oppression. I would like to also have you comment on the power of listening. So many times, especially in leadership, we presume that we know what's best for those who we're advocating for, and we fail to listen first. And what I found so inspiring about your journey is that you started by listening. You started by listening to your patients and their family members. Can you speak to the importance of listening with intentionality in advocacy work?
Oh, I think that's a great question. And I hope you don't mind me being a storyteller again. But when I think about listening, I'm reminded again by a personal experience I had. And I'll try not to get teary eyed thinking about her. But early on, when we had our grant funding, there was a lady who was undocumented and did not speak English well, if at all. And she was pushed into my clinic because she had an urgent need with nausea and vomiting. She was a colleague's patient, but our nurse said, would you see her? And if she clicks, maybe we'll just switch her over to you. And so I went through this whole thing about, nausea and vomiting and spent all this time and was a good doctor with my hand on the doorknob, getting ready to walk out. And, whoever you feel is responsible for those little moments when you have the spirit within you or whoever it is that's telling you, wait a minute, you're not done yet. I had this little voice that say, why don't you ask her why she thinks she has nausea and vomiting? Because I gave her my very intellectual reason about the HIV meds, right? And so I'm got my hand on the door and I turn back around. I'm like, well, why do you think you have nausea and vomiting? And she goes, well, I know why. And I'm like, oh, you do, being my little, prim self. And she said, I'm pregnant. So I had spent the entire 20 to 30 minutes talking about HIV meds, how you need to take it, and how we're going to help you get over your nausea. Where if I just asked her to begin with, it would have saved us lots and lots of time. And I think that's so true. And I think when you are advocating, I think it's easy for us to talk over each other. We all want to make our point. But if we can just take a pause and breathe, and that's one of the things that, again, I mentioned Jenny and Andrea, that they've talked to us about doing, is that when you're in the room with policymakers, people in your own, group or whatever, is find out where they are before you just start like vomiting all this information. Where are you? And do you have questions you want me to answer first before I get into my, big spiel or whatever? I think that you're right on. That's a really important clue for all of us to learn because it doesn't come naturally sometimes.
Absolutely. I love that story. And never apologize for stories. I think those are the best ways to get our points across. So thank you for sharing that. I see a couple more things in the chat. So lots of gratitude to you, Dr. Thornton.
Thank you.
So we have a comment from Dr. Bowers. I love your point about checking in with who you are advocating for. And she also mentioned the point often gets lost. Advocacy can get confused with saviorism. Can you comment on
Yes.
that?
Yeah, well, and I think that goes back to that patient, that I used the example, and I'll use another example. She ended up not wanting to carry forth with the pregnancy, and that was really hard for me, and that was really hard for the nurse working with me. And this young woman said to me, and again, she couldn't speak English. We did everything through an interpreter. She was probably not very educated, but she was so eloquent. And she pointed out to me, I don't feel like she even said it, I don't feel like you're hearing what she didn't say it like that, like I don't feel like you're hearing, but it was basically the equivalent of that. Because I was saying, oh, you can have this. At the time, we didn't know it was twins. But I said, you can have this baby. The baby doesn't have to have HIV. And I went on and on with all this spiel, as if I hadn't learned already. I'd totally missed the boat that she was pregnant. But then again, continued to vomit my perception. And she said, I can't have this baby. I have 4 children in Honduras that I'm sending money to. I can't lose my job or my children may lose their life. Wow, that was a smack in my face. Here you are, well-educated, moneyed white woman who is a physician telling this lady what her struggles are. And she very eloquently just chopped me down to what her priorities were. And we changed. My nurse and I, we said, okay, we're going to help you with what you need to do. And we had to set aside our own personal views. It wasn't really, well, I have twins myself. And so it was really hard for me, but I needed to listen to her. And that was a lesson I've never forgotten. And I think the person that pointed that out is so true. And, we start on this road to advocacy for a cause or for a person. And it's important to step back and see, have our priorities changed? What have we improved on? And maybe now we need to, curve this a little bit. But I think that's right on. Check in with those that you are trying to represent.
Absolutely. Dr. Thornton, we do have a question from Tiffany Howard, who asks, do you have any advice on how to get children involved in advocacy/change in a positive way?
Oh, that's a great question. And my kids would probably be going to hear this. So this is a small way, but I forgot, I actually did this in college too. So an easy thing that you can do is at Christmas time, if there's organizations that you like to be part of, so my kids, every holiday, so whether you celebrate Christmas or whatever holiday it is that you celebrate, we as a family would sign up with our church to go ring the bell for the kettle, right? And so my kids hated that. But that's something that we made them do. And also, we talked a lot about voting, and I'm happy to say that, and I have one son that has major social anxiety, and he probably hated that a lot. And even going voting for him can be difficult. And so he loved it that we could do mail-in voting this year. But I tried to instill that in him, and I'm so proud of my 3 sons. They're all 3 very different, but I think that's a great thing. Try to find something that it's acceptable for them to be part of, and then let them see you modeling this. Something as easy as voting. Because for some people, voting isn't easy. Like I said, people with social anxiety, the thought of going where there's crowds of people and standing in line and that's another, I think, example of being vulnerable, because for me, it doesn't feel vulnerable. I'm so proud to be there. But for my son, he hates that. And he was so thrilled that there was the mail-in voting.
Wonderful. Thank you, Dr. Thornton. We have several more thank yous. Dr. Satovia writes, your point about exhibiting grace and being polite really resonates.
That, it's so funny that was, when I look back, being a grown woman, that was one of my biggest lessons, when Jenny would stand in front of us and say, don't forget to say thank you. Don't forget to, she would say that so constantly. And I was like, oh my gosh, I have people do things for me all the time. Do I ever stop and thank people, And so that has become part of, my rhetoric when we're doing, and hopefully not just rhetoric, but meaning it sincerely, because you are people's time, and all of us know how busy we are. And just to squeeze somebody in for 15 minutes sometimes can be a huge ask to get FaceTime with someone. And so it's worth thanking them. So one thing I just thought of, and I jotted my note because my good colleague, Dr. Rick Altice, mentioned this, and I love this, and I jotted it down because I didn't have it on my slides, but he talks about the coalition of the willing. And sometimes it only takes one of you or two of you. So, look for that coalition that you can build around yourself, that coalition of the willing, because it is a lot easier to have a voice if you can, not that you can't be an advocate alone, you absolutely can, but it does make it easier if you can find another voice to join with.
I love that. That's powerful. The coalition of the willing.
Yeah, isn't that great? I learned that one this year, so I love it.
Yeah, fantastic. I do have another question, and please, participants, please keep the questions coming. I will continue to man the Q&A and share your questions with Dr. Thornton. So Dr. Thornton, being in infectious disease, we're really trying to get our patients vaccinated. And we're seeing a lot of vaccine hesitancy in the community. Can you speak to talking to your patients about vaccines, especially those who are hesitant, through the lens of advocacy? What is your approach?
Oh, that is such a good question. And as you know, Vijay, this is something that we end up doing every year, because for some people, we know some people don't realize what a struggle sometimes we have just getting people to take their flu vaccines. So I do what I've been trying to do each time, and I find that I'm getting such an instant gratification getting to type into the electronic medical chart their date of their vaccine if it's not already in there. So I am making it a point to ask each patient, and to my family's displeasure, I'm even asking waiters and waitresses and neighbors if they've been vaccinated. I try to do it in a non-threatening way. And I say, oh, have you been able to get your vaccine yet? And usually, you can tell by sometimes they're posturing or what they're going to say. And then I say, well, particularly if they don't know me, I'll say, I'm an infectious disease doctor. Is there any question I could answer for you that might help with that? And so I actually did this we went away last week, and I did it with the waitress. And I said, well, what questions do you have? Maybe I can help you. And so we talked about it. And by the end, she said, I'm really going to give this some thought. And her 14-year-old son had already been requesting that he get vaccinated. So you never know who you're talking to, who's come before you. You may be like the third person that's talked to them about this, and it may just be just enough to push them over. You might be the first person, and it's going to take 3 more people after you. But, you just don't know. And so I try to not get to like, oh my God, you're stupid. You need to take this vaccine, don't say that. but have that feeling of, talk to me about what is the issue. And when I've been trying to tell, a lot of people have told me that they think, well, it's happened so quickly. And I'm like, what you're hearing about's happened quickly. But actually, with the other viruses that have preceded it, Ebola, and then the other SARS viruses, there actually have been vaccines that were developed that we weren't aware of. And so you're only seeing this picture of the COVID, but actually what you don't know is for 10 years, people have been out there struggling working with the Ebola vaccine and other vaccines, and these are the platforms that we're using. And so trying to give them some knowledge, because when I started lecturing about the vaccines, I didn't even realize all the pre-work that had been done on other viruses with mRNA and other things. And so I tell them that, hey, that's a good point, but this is what I found out in my own personal education that I found. And the particular lady, the waitress that I mentioned, she was like, oh, I didn't realize that. And I'm like, yeah, it's not, yes, this particular vaccine is new, but the concept is not new with the mRNA. You've just now heard about it because we weren't listening. We weren't paying attention. We didn't know about it. So that's kind of what I've done. And also I found a lot of people with hesitancy are a little bit more willing to take the Johnson & Johnson, even amidst all the other stuff, because it's just one time.
Just one.
So.
And I love that you come at it from a place of inquiry, as opposed to an accusation. You start with a question. And I love this story. It came from one of my colleagues during a discussion with someone in the community. who hadn't been vaccinated yet. And this community member sort of responded with, "What makes you think I don't want the vaccine?" It wasn't so much not wanting the vaccine, it was lack of access, lack of transportation. So there's so much more than just hesitancy alone, which is why the inquiry is important. So thank you so
That
much.
is right on. My oldest son, who we've always joked is a socialist, who I really think he is a socialist, that was the point he made to me when I was complaining about people not getting vaccinated. And he said, "Mom, have you ever thought maybe they don't have access?" You know?
Yeah,
So,
absolutely. Absolutely. Yeah, spot on. Dr. Thornton, this has been an exhilarating hour. Thank you so much for sharing your wisdom and for your expertise. I know I have learned so much. And your mentee, Dr. Sundaration, just wrote, "Thank you so very much for your excellent, heartfelt, honest, and very relatable presentation. There's so much advocacy we do in what we do daily. Thank you for your stellar mentorship. Feel much gratitude and pride."
oh, how sweet. Well, thank you guys for allowing me to be part of your morning. I appreciate it.
Thank you so much,
Thank
Dr.
you.
Thornton. Thank you. We are going to move on to our next speaker. I'm going to go ahead and share my screen again. It is truly a privilege and my pleasure to introduce our next speaker, Ms. Nikita Richards. Ms. Richards takes great pride in serving both her community and the state of Illinois. For most of her life, she served as a social equity advocate. She is the City of Bloomington's Community Relations Manager and a public relations professional who has been featured by Huffington Post, Business Insider, MSN, and Morning Joe. She previously served in the Navy and established Central Illinois's first administrative court located in Bloomington, Illinois. Her service is also notable for service on the board of directors for Planned Parenthood Illinois Action and NPR Illinois, serving on U.S. Senator Tammy Duckworth's Service Academy Board, and she is recently the recipient of the 2020 Outstanding Service and Leadership Award by Illinois State Treasurer Michael Frerichs. I have had the privilege of working with Ms. Richards on the Illinois Council on Women and Girls, where she serves as chair of Leadership and Inclusion and also sits on the Academic and Economic Opportunity Committee. Ms. Richards was elected to the Illinois State University Alumni Board of Directors, received the 2019 YWCA Women of Distinction Award, and in 2018 earned the Outstanding Woman in Communication Award by the Association of Women in Communication, while making history as the first African-American woman to earn the highest award bestowed by the organization. In April of 2020, she was elected as the first Black woman to chair the Democratic Party of McLean County. As a lifelong advocate for youth and creating safe spaces for young people, she served on the McLean County Foster Care Coalition as a family court liaison, where she fought for unification of families within the McLean County court system, served as an active NAACP member, and a mentor for the Boys and Girls Club. Nikita was born and raised on the south side of Chicago. She is the proud graduate of Illinois State University. She is the proud mother of Kaylin Richards, an amazing daughter and a young leader in her own right. And when she has a moment of free time, you can find her educating communities about the importance of voter education and restorative justice, bringing on documentaries and fellowshipping with her Mount Pisgah church family and friends. And Ms. Richards is going to be talking to you today about transformational leadership. I will tell you on a personal note, I said that we have had the pleasure of crossing paths on the Illinois Council on Women and Girls. And I have to say, I have never seen such a fierce, strong, inspiring advocate and leader. So Nikita, I just want to thank you for all that you do in leadership, and especially for women and girls in Illinois. You are my shiro. I am so proud and honored to know you, and I just can't wait to hear from you. So thank you.
I am so excited to be here with you. And oh my gosh, my dear friend, I hope the audience will give me a moment just to gloat. Dr. Prakash, Lydia, thank you so very much for this opportunity. You know, you hold a very special place in my heart, and it has been amazing serving with you on the Illinois Council on Women and Girls. Thank you so very much. What a pleasure to join you all this morning. By the time we go our separate ways, you will be able to clearly define transformational leadership, or at least that's my hope. There's a lot of components to this particular concept, but I love to speak in layman terms and really help people relate this to their own personal lives and professional lives. You'll also be able to identify your own standards of behavior, and so we'll explore that a bit. Recognize how these standards of behavior impact your transformational leadership encounters with others, and then you walk away with some examples as to how to apply transformational leadership to your current advocacy work. So again, it is a complete pleasure to be here with you. And so I'd like to begin by just sharing a little bit about myself, some things that you won't necessarily find in a bio. This little brown-skinned girl grew up on the south side of Chicago in what was then the Robert Taylor Home Projects. And if you're familiar with the projects of Chicago, these were housing blocks that were built to keep primarily Black and brown folks in a segregated portion of the inner city. And so this portion of the city was impacted greatly by redlining. And redlining, as we know, contributed to so many socioeconomic issues within the city of Chicago. These housing projects have since been demolished, and my particular one was considered the red buildings, right? And it was riddled with crime and gang violence and socioeconomic woes and trauma and challenges that primarily were created by a system of oppression and systemic racism. So there was a lot to overcome there. And I experienced that particular part of my life with my biological family. You see, I come from a dual family. I have both my foster, then adopted family that I absolutely love, but then I also have my biological family, and I've been fortunate enough to have relationships with all of these amazing members. But during the early part of my childhood, it was quite challenging, and then when I was adopted with my family that raised me, there were some changes. And so it was interesting as a child watching this shift, right? Experiencing this shift in my life, where you go from this life of certain social, economic, and social justice challenges to this life of privilege, so to speak. I was fortunate enough to still be within both families of color. So I was raised by Black families, both biologically and adopted. And that's not necessarily common for foster children. And it's interesting because as I grew in my professional career and in my civic engagement work, I found myself advocating for children that looked like me, children that experienced the same things that I did, youth that were traumatized, youth that struggled with identity, youth that struggled with having to make these right or wrong choices with little guidance. And so then I found myself as an adult joining and participating and volunteering on foster care coalitions across the state. So it's interesting as I listened to Dr. Thornton talk about how advocacy usually is a result of your own personal experiences. I could not agree with her more on that. Much was gained from my upbringing, particularly the understanding that more often than not, there were people in positions of power, access, and opportunity who could have made an incredible difference in my life and the lives of other impoverished people like me or my family, but who chose not to for many reasons. People who considered extending equality and equity to their fellow man and their neighbor as an act of going the extra mile versus simply being an act of kindness, justice, and fairness. Throughout my life's work of service, I've remembered these experiences and vowed to do all that I can for as long as I can with what I had in order to impact the lives of people around me positively. That was so important to me to remember these experiences and apply them to the civic engagement and advocacy work that I found myself serving in. It's one of the many reasons I proudly serve with organizations like Planned Parenthood of Illinois, where the CEO, Jennifer Welch, made a decision to increase the pay of frontline workers, survey the staff to determine their needs, and then after listening to the needs of the staff, she made the decision to implement operational changes based upon staff input. That's incredible. Oftentimes leaders allow their egos and their sense of I know it all to guide their leadership. And in this case, she did not. I think about the work that I do with Lieutenant Governor Juliana Stratton here in Illinois, on the Illinois Council on Women and Girls, where Lieutenant Governor made an intentional decision to appoint girls to the council in order to allow them access to opportunities and resources. She made this change so that the proper representation would be present on the council, and so that girls, not what I like to say seasoned or highly decorated and accomplished, and let's just be honest, sometimes disconnected women would make these decisions on their behalf. She wanted girls from all walks of life to go through this diversity-focused application process and to be selected to basically make life decisions and policy decisions for themselves. Both of these women, the CEO of Planned Parenthood Illinois, Jennifer Welch, and Lieutenant Governor Juliana Stratton, are prime examples of what I call and what I would identify as transformational leaders. And they've used their transformational leadership traits in all forms of advocacy and to be better allies for their communities and for the people around them. So I've talked a bit about this concept of transformational theory, transformational leadership. So I'd like to take the time to kind of break that down a bit. Transformational leadership is basically a theory of leadership where a leader works with teams to identify needed change, to create a vision to guide the change through inspiration, and execute the change in tandem with committed members of any particular group. It can inspire and inspire positive change for all those who choose to follow, and that's a key thing, right? Everyone wants to have leadership opportunities, but we also need good followers in the work that we do. And transformational leaders are generally energetic, enthusiastic, and passionate. Not only are these leaders concerned and involved in the process, they are focused on helping every member of this particular group or organization succeed as well. They're not out for self, they're focused on the entire group being successful. And studies have reported that healthcare organizations that adopt transformational leadership see gains in staff satisfaction, which in turn may have an important effect on reducing the rate of patient care efforts. I know for certain that's one of the perspectives that one of the results that we've seen at Planned Parenthood Illinois as it relates to really supporting the staff, the frontline workers who are there on the ground with these patients, listening to them and realizing that they are brand ambassadors. Who best to help the organization make better decisions on behalf of our patients than those who are working directly with our patients? And we've even taken it a step further in that we bring our patients into the decision making through surveys and input or opportunities to gather input and data from these patients in a confidential manner. Researcher Bernard Bass developed what is referred to as today's Bass's transformational leadership theory. According to Bass, transformational leadership can be defined on based on the impact that it has on its followers. Bass suggests that transformational leaders garner trust and admiration from their followers. The theory of transformational leadership has been consistently articulated as a form of leadership grounded in an activist agenda. And so if you think about many of the movements that have taken place over the last 2 years, they've gotten much more media attention, much more publicity. But if you take a look, at the way in which many of these activists are going about carrying out their civic engagement and political agendas, they're actually implementing much of the transformational leadership components, and we'll get to that in a minute. But I want you to think about some of the activism that you've seen lately, and then think about some of these components that we'll discuss later, and try to connect the dots between those. This activist agenda typically combines a rights-based theory that speaks to this idea that individuals are entitled to be treated with dignity, respect, and absolute regard, with a social justice component. And what has happened now is that people who practice the transformational leadership style have taken it to and applied it to social economic issues, to enhance and move the needle along in progress. So transformational leadership therefore recognizes this need to begin with, critical reflection and analysis, and the need to take action in an effort to redress wrongs and to ensure that all members of any organization are provided with a level playing field, or at least as possible. In other words, it's not simply the task of the corporate, educational, or system leader to ensure that all employees or members of any group are successful, but instead, it's essential that the work of the leader is to create these learning contexts and communities that are filled with social, political, and cultural capital in order to enhance the individuals within that group, and to provide equity of opportunities for all members of that group, ultimately making them more well-rounded and better participants in the workforce, their field of studies, and society. So as we go through this concept of transformational leader, I want you to consider this. Have you ever been a part of a group where someone took control, whether it be in the academic setting or in the work setting, or in your community organizations, and this person was able to convey a clear vision? They were able to exhibit amazing passion for the work and an ability to encourage others and empower others to be focused and recharged and energized just like them. Well, that person might just be a transformational leader. So think about this person, and in the chat box, I'm interested in knowing or having you describe this type of leader. What was it about them that left a lasting impression on you? So let's take a moment to think about that person, that energized leader, that person that was able to convey these clear visions and kind of rally the rest of the group to move towards the mark. Describe what was it about them that left an impression on you. So I'll give you a moment to mention or provide your descriptions now. And you can use the chat feature. I'm seeing courage, integrity, and passion. Transformational leaders definitely have to have courage. They definitely have to have courage. It's not easy, because transformational leadership requires you to kind of tap into being vulnerable. I love that. Someone says the person was authentic. Let's see here. Oh, you guys are bringing these comments in. Great, great. So someone says the person was authentic and allowed themselves to be vulnerable. That's it. Let's see. Contagious enthusiasm. Oh, I love this. Let's see. Amanda says role model the behaviors regardless of the audience or being on stage. Absolutely. We're going to get to that. We're going to get to that authenticity. That leader was bold, passion, optimistic. I like this. Looks like Teresa says soliciting feedback and active listening. Yes. It goes back to this transformational leader not being so focused on their own ego, but being willing to, again, listen to those frontline ambassadors who are on the ground and in the trenches, who are basically subject matter experts, and trusting their feedback to make decisions as well. Yes, refusal to accept the status quo. I've had a number of transformational leaders in my life that have also exhibited this. Willing to admit what they did not know. Oh my goodness, this is huge. This is huge. Oftentimes, I know we all have had encounters with people or leaders who like to display that they have all the answers, right? And it's like, that's not necessarily true. None of us know everything. And I find it to be most attractive and most beneficial when a leader is able to admit, hey, you know what, I have to get back to you on that, or to give you credit about a subject or an idea that you perhaps brought to their attention. You know, I really like what you said there. Tell me more about it. You know, that leader is willing to hear more from you as the subject matter expert, learn from you, and then apply it. I love this. Willing to say, I made a mistake. Absolutely. Absolutely. Collaborative. That leader is humble. I'm seeing unwavering, and let's see, this leader created unstructured space for a real connection. Oh, Wendy, that is huge. That is huge. I see Teresa's agreeing. Yes, you're absolutely right. They let others lead. Yes, 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 yes. Not afraid to create this power balance, right? Lending power to others and not feeling as though you're missing out on something, or as though you're it lessens who you are as a leader. Oftentimes we see that there are people who are hesitant about lending or sharing power. And transformational leaders want the entire group to identify themselves as individual leaders. They want everyone in the group to grow. Absolutely. They're reflective, they're leading with love, they're empathetic, and they're not afraid to fail. You all ace this one. Amazing. All right. So again, I just want you to kind of think about those leaders, and then we'll come back to this, right? So let's jump into talking a little bit more about the different points of transformational leadership. And there's 4 of them, and I'll go over them briefly with you. But Bass suggests that these particular components really ultimately will help someone who is at the early stages of advocacy arrive to a place of wholeness, of true awareness. And then after the awareness, this person should be able to enact enact all of these components to their advocacy work, ultimately making them better allies, okay? So intellectual stimulation really refers to the transformational leader the characteristic of the transformational leader that will speak to challenging the status quo, right? The transformational leader isn't in the business of going along to get along. This person will encourage creativity among fellow followers, and the leader encourages followers to explore new ways of doing things and new opportunities to learn. The consideration component of transformational leadership really involves the leader offering support and encouragement to individual followers. In order to foster supportive relationships, transformational leaders keep lines of communication open so that followers feel free to share, and so that leaders can offer direct recognition of the unique contribution of each follower. Inspirational motivation, which is what a lot of you referred to even in your comments in regards to characteristics that you've seen of some leaders in your own lives. Is the inspirational motivation concept refers to transformational leaders having a clear vision that they are able to articulate to followers. These leaders are also able to help followers experience the same passion and motivation to fulfill these goals. And lastly, idolized influence refers to transformational leaders serving as role models for followers. I saw many of you make comments that spoke to this very thing, so you were already right on board. This is so important because followers trust and respect the leader. They emulate this individual and internalize his or her ideals. If you are able to master these four components, then what you've really created is true buy-in and from your followers and from your group and from your teammates and your colleagues and from the people for which you're advocating for. You can't go into any situation, any community, trying to advocate for those individuals without gaining trust, without creating the sense of authenticity, without having credibility. And by applying these components of transformational leadership, it's my hope that you will develop those particular skills in order to strengthen your relationships with your organization, with your colleagues, with the employees, with the communities in which you're serving in, so that you can really increase and again, enhance your advocacy work. And so I know we're not in this present world, but I sure would love to see, you know, how many of us, and I know I can't visually see you, but I'm interested in knowing how many of us who, as we're thinking about this, feel as though we have some work to do as it relates to becoming this true transformational leader, right? It's difficult. It really is. And it's not something that we should look at and think, oh, I've arrived. Transformational leadership is not a sprint, it's a marathon. It's a lifelong process of self-evaluation. And I encourage us, each of us in this particular conference, to kind of support others in their journey. We have to remember to meet people where they are, right? You may have started your advocacy journey, you know, a long time ago. You may have just entered the ring of advocacy work because you've had an aha moment, and that's okay. So for those who have been in the game for a long time, we have to give those who are just now coming along and being woke and aware and true advocates and allies, we have to give them grace. We really do. And we have to understand that people are at different stages in their advocacy journey, and it takes time. It takes time, and it takes understanding, and it takes us all applying these particular components in order to really push the advocacy needle along, okay? So we've talked quite a bit again about transformational leadership, but let's discuss, how do we even arrive here? Let's just be frank. We have all these terms, we have all these concepts, but the nitty-gritty work begins with understanding that we have to take a very important step, and that is to acknowledge power and privilege in any situation, organization, or within ourselves. When actively practiced, transformational leadership will cause leaders to explore questions of justice, democracy, and the dialect between individuals as it relates to accountability and social responsibility. Scholar E.J. Weiner, I really enjoy his work, so you'll hear me talk quite a bit about him in class. I can't help it. But E.J. Weiner calls for leaders to confront more than just what is, and to work towards creating an alternative political and social imagination that does not rest solely on the rule of capital or the hollow moralism of neoconservatism, but to instead be rooted in radical democratic struggle. In the case of academic institutions such as SIU, I actually think that it's important for educators to take a fundamental task to apply these transformational components. It's important for educators to ask questions about the purpose of schooling. What about the idea? I mean, what ideas should be taught within the institution, and what is considered truly successful, right? Think about that. Weiner states that this type of critique lays the groundwork for the promise of schooling that is more inclusive, democratic, and equitable for students. According to Weiner, critique through a transformational lens to or creates an institution that is anti-racist, anti-sexist, anti-homophobic, and responsive to a class exploitation. So I like to take this concept a bit further, and I add that this type of critique, along with an acknowledgement of power and privilege, enhances a leader's ability to serve as an ally and advocate. I strongly believe But it is not until we arrive at this point that we're able to fully become our true selves and become these transformational leaders who can effectively apply this work to advocacy. If not mindful, we may remain captive to our own standards of behavior, standards that are typically riddled with bias, classism, and otherisms. Standards of behavior are a set of official guidelines that are meant to govern employees' actions, their speech, their attitudes, and more. But in other words, I like to just sum this up by saying the standards of behavior are truly kind of like things that we conjure up, right? Social economic norms are standards of behavior or help to shape our standards of behavior, and they're not always accurate. I love this quote. Telling yourself that you have no bias, that you are one of the good guys who believes in equality is the best guarantee that you will continue letting your unconscious bias control how you treat people. It's so important for us to evaluate our standards of behavior. So let's think about them a bit. What does a leader look like to you? Do you envision someone who is a wheelchair user as a leader? Right? How does a leader engage with others? Do you consider someone who's an introvert as having the capability to engage effectively with others? I think that's so important to think about this. To consider that. Oftentimes people don't. Oftentimes we have these biases about what a leader looks like. I think about the standards of behavior that were once placed on women. I think about how people would say things as it relates to how women would wear the color of their hair, right? How women would, blondes were considered less of a leader. I think about how, perhaps if someone is slouching in their chair, perhaps, as someone walks past their office, maybe that isn't seen as a leadership behavior, but could it be that that person may be just a little tired, right? We place all these different standards on behavior, and oftentimes we limit others, and it's like, is that really right? Right? Let's think about our standards of behavior as they apply or as they relate to how we see people and how we include others in the process of leadership development as well. Okay. All right. So cultural humility, this is huge here. And I want to take a moment to shift gears. If I can pause, let me see here. I apologize. And give me one moment here. Don't you just love technology? Give me a moment. And I am going to X out here. If I could be taken off camera for one moment, or do I have control of that? Let's see here.
You can do that.
Perfect. One moment. Let's see here. Okay, perfect. Is everyone there? Perfect. Sorry, I was having some technical difficulties there, but you all are so patient. Thank you. All right, good to go? Perfect. So can everyone hear me?
We can hear you.
Oh, perfect. Thank you so much. I just love technical issues sometimes, but so let's move on to cultural humility, because I think this is another concept that's really important for us to explore in conjuncture with understanding our own standards of behavior. So, oftentimes when people talk about culture, they swear up and down that they understand it. And it's like, no, you're missing the mark again. So I always like to kind of explore this with folks and begin by giving a general definition that culture really is not about the norms and values of any particular racial or ethnic group. It's about how the norms and values of a particular group are expressed, and how our thought or how we think about these particular norms and different ways that we engage with others, right? It's about orientation, and depending upon your socioeconomic position and immigration status and or sexual orientation, your culture may be different, you know, from mine. It may be different from your neighbors. And so it's important to kind of explore that with folks. A broad and more critical definition of culture refers to shared experiences of a number of people within any particular group, and helps us to really take a look at these behaviors. And so I like to break down a person, or the characteristics of someone who explores cultural humility. And I think this would be a good time to talk about that. So a person who practices cultural humility really is someone who explores how their own cultural norms impact the way they view themselves, the families that they're working with, the communities in which they found themselves serving in, and the situations that they're facing. This person is open to developing their own, or developing known cultural humility within those cultural groups. They're focused on reflecting on how their own values and the values of their organization have an impact on their approach to working with others. And so I think about a comment that was made previously during Dr. Thornton's presentation, and it referred to the saviorism concept, right? And so it's so important to not walk into situations as though you understand fully about any one particular person's or group's culture. And these folks, typically transformational leaders who really understand culture and humility, understand how important it is to see people first. They use people first language, such as a person with bipolar disorder, or you know, people with mental health diagnosis, versus some of the other marginalized language that we can use towards people. Transformational leaders are able to recognize and communicate that the people being referred to should be referred to first and foremost, and that these folks are multidimensional, right? And so I think if we're able to really identify and focus on both our own standards of behavior and cultural humility, then it also helps us in enhancing our advocacy work. So I think this will be the time for us to take a look at an example of how cultural humility really has an impact on advocacy. So I'm going to share my screen, and I'm going to, let's see here. Stop. Oh, look at me. Okay, here we go. I'm going to stop sharing for a moment. I'm going to go to a different screen, and hopefully this, let's see. Here we go. All right, let's take a moment to explore cultural humility, and again, its impact.
Lisa is a white American nurse from Louisiana who has just accepted a job offer at a hospital in El Paso, Texas. Aware that many of her new patients will be of Mexican descent, Lisa spends several months reading literature on the Mexican culture, bettering herself in the population. A well-informed Lisa feels confident and culturally competent before beginning her new job. Due to the increasing diversity of our world and the mixing of different cultures, the importance of cultural competence in the professional world has become more salient. Yet cultural competence can only take us so far. What's even more desirable? Cultural humility. Cultural humility is a humble and respectful attitude toward individuals of other cultures that pushes one to challenge their cultural biases, realize they cannot possibly know everything about other cultures, and approach learning about other cultures as a lifelong goal and process. Cultural humility was established due to the limitations of cultural competence. Some professionals, like social workers, medical professions, or educators, believed themselves to be culturally competent after learning some generalizations of a particular culture. Cultural humility encourages an active participation in order to learn about a patient or client's personal, cultural experiences. After a few months of studying Mexican culture and working with some Mexican patients, Lisa feels confident in her understanding of the culture. Due to her knowledge that Mexicans are Catholic, she requests a priest for one of her patients without first consulting them. It just so happens that the patient is actually Jewish and feels offended by Lisa's assumption. If Lisa took an approach in cultural humility, she wouldn't assume to know everything about people with Mexican cultural backgrounds. She would ask her patients questions to gain a better understanding of their own personal cultural history, experience, and beliefs. The concept of cultural humility was developed by medical doctors Melanie Tervalon and Jan Murray Garcia in a 1998 academic article published in the Journal of Healthcare for the Poor and Underserved. In this article, Tervalon and Murray Garcia identified three things to cultural humility. First, self-critique is a lifelong process. Cultural humility suggests being humble and aware of one's deficient knowledge of other cultures. Mostly, it's important to be okay with not knowing everything. Self-evaluation and learning about other cultures is a lifelong process. Each individual is multidimensional with a complex cultural identity. For example, Maya, a teenage girl from Israel, is not Jewish, nor does she eat kosher. She is a Palestinian Muslim who is originally from Syria, but is considering converting to Baptist Christian. Cultural humility also requires
Can you unmute Ms. Richards?
difficult to truly grasp how much they benefit from this privilege and power. Practitioners can begin by looking at their clients as experts on their own life experience, history, and interests. Hence, a practitioner may be an expert in their field of mental or medical health, but their client is an expert as well. The goal is to collaborate and devise the best solutions for the client's situation. Practitioners should utilize their own perspective when working with clients to identify clients' fortes and skills. A clinician's job is to approach clients compassionately, interview clients as experts of their own life histories and experiences, and identify and build on clients' competencies. Finally, affiliation with advocacy groups is important. Cultural humility encourages professionals to reach out to advocacy groups on a systematic level, sharing the knowledge and value of cultural humility that participate. Ms. White is a school counselor who is seeing 11-year-old Lele for high anxiety. Ms. White has seen it time and time again. Young Asian Americans who feel familial pressure to excel and succeed academically. Ms. White initially feels a tinge of aggravation toward Lele's parents. Then she remembers the value of cultural humility. Perhaps Lele's anxiety has nothing to do with this stereotype of Asian culture. Ms. White thinks she could be referencing her own American values of allowing children more academic lenience and freedom. Ms. White has an open mind when she schedules a meeting with Lele's parents. She asks Lele's parents questions about their views and beliefs. She tries to empathize with their cultural values and why they hold academic excellence in high regard. She becomes a student of their cultural values and beliefs and works within these parameters to proceed with Lele's family. Cultural humility encourages a respectful attitude toward individuals of other cultures. It pushes one to challenge their own cultural biases, realize their own limitations about cultural knowledge, and look at cultural learning as a lifelong goal and process. There are three facets to cultural humility: lifelong self-critique, challenge of power imbalances, and affiliation with advocacy groups.
All right. So I hope that after taking a look at that particular presentation, sometimes visuals really help us break down these concepts and think about them more. I'd like us to, after listening to all of that, I'd like us all to think about the work that we do every day, whether it be in the community, whether it be on the job, and think about the way we engage in leadership, the way we engage in advocating, whether it be for our colleagues and our employers or friends or families or certain particular groups or causes. And then I want us to take a moment in the chat box to list out transformational leadership qualities that you see within yourself, and put or enter an example of how you have practiced or demonstrated transformational leadership. So we'll take a moment and we'll do that in the chat now. And if you need me to repeat that, just let me know. Let's see here. Oh, it looks like I am. Oh, there we go. Thank you. And let's see here. Someone says, using personal experiences of pain and harm to drive empathy for others. Okay, so someone needs, okay, so let me repeat the ask. The ask is that after you've taken a look at the understanding of culture humility, and after we've discussed transformational leadership and advocacy and standards of behavior, I want you to take a moment in the chat box to list one example of how you've demonstrated transformational leadership as it relates to advocacy. Yeah, just one example. So it could be anything. It could be where you exhibited transformational leadership traits, advocating for a cause, or for a new policy at work, or in maybe helping a coworker become acclimated. Let's see. Someone says stimulate discussion, listen to other perspectives when making decisions. So these are things that you've actually done. Okay, wonderful. Let's see, Jennifer talked about starting with asking questions. Yes, yeah. And I hope that when you've asked those questions, Jennifer, you've developed or kind of gained more knowledge about the person or group in which you were advocating for. Yes, absolutely. You always want to start with asking questions. It's interesting because people will assume that they know they know these things and or know a particular subject matter, and then realize that the more questions that you ask, the more you actually don't know. and again, I go back to the patient-client experience, right? Let's see, respecting others and their contributions, trying to lead by example by asking questions of those I work with. Wonderful. Yes. I see a lot of people mentioning that they start with asking questions. You all are ahead of the game because that's not always the case when leaders are engaging with others and trying to perform advocacy. What are some other examples that you have demonstrated on your own as it relates to transformational leadership? We think about some of the components of transformational leadership that were mentioned previously, things like leaders challenging the status quo, right? In what ways have you challenged the status quo? In what ways have you encouraged creativity? Give an example of where you've been supportive of particular groups or employees or whether it be clients and things like that. Give examples of where you've been considerate as a leader, right? All those things are examples of transformational leadership. Examples of where you had to work as a team and maybe encourage people to buy into your particular vision. How did you go about that? Listen to others and try to see things from their perspective. Advocate for others when the outcome for myself may be less desirable. Wow, that is huge. That is huge, Ashley. Absolutely. That is true transformational leadership. It's not always easy. Let's see here. Ask the individual how to say their names and what are their preferences. Yes, that's not going the extra mile. That's actually doing what's just and fair and appropriate, and that is true transformational leadership. Absolutely. Let's see here. And then it says, and then this person says, and then let's see here, bring these discussions to meetings to make changes, right? Applying what you've heard from the workforce or from this particular group, and discuss these things and see how you can enhance your advocacy. You're absolutely right. Great examples of that, right? So It's interesting. As I listen to your examples, you're spot on. Transformational leadership in practice looks like, garnering or bringing community partners to the table, making sure that they have a true seat in decision making. Transformational leaders build competency and the capacity to facilitate staff engagement. Yes, absolutely right. You guys are spot on. Absolutely. Transformational leaders, as they're facilitating, this engagement within their community, they're focused on assessing the status of the community to determine, what the needs are, and then they take priority or prioritize what they're listening to, what they're hearing, and then take action. Transformational leaders engage staff and, again, build capacity. These leaders are supporting their staff at all levels of engagement. They're focused on, again, the entire group being successful, but they're also in a state of pushing individuals to be creative themselves, right? These leaders understand the need to move upstream and understand the root cause of poor health conditions in any situation. These leaders also understand how to foster the desire to build skills and the capacity rather than focusing on training alone. Oftentimes, leaders make the mistake of just saying, oh, that person was trained on this already. And it goes far beyond simple training. You have to develop a mentality of coaching folks and actually bringing them into your work and bringing them into the fold and supporting them, right? Transformational leaders understand the importance of accountability and to support individuals through their accountability stages, right? They hold their colleagues and peers to certain standards, especially those who refuse to participate in the mission and the vision of the organization, or those who intentionally undermine the work. They set goals and measure progress, and transformational leaders challenge others with high standards and encourage them to communicate their visions and to be optimistic about future goals, right? And so it's important to think about some of the ways in which you could actually, some of the ways in which you could actually do this in practice. We can create position statements that define the population and health and its needs, and describe goals to achieve an aim of the improved outcomes, right? We can implement policies that allow providers to lead, to encourage leaders or provide leaders the time and training needed to act as transformational leaders. We can review, revise, and develop policies that address health equity, and some of these would be, and highlight, basically, after you assess the health equity, it would be important to highlight the needs for access to healthy, food within a community, as an example, or determine how you could better serve or work alongside minority-owned businesses. So those are just some examples of how you could put transformational leadership into practice. And so I hope that after listening to all of that, you've walked away with some key examples of how to take what you've learned and apply it to your advocacy work, but ultimately have a better understanding of how to identify those traits you already possess, and ultimately how to encourage others to tap into those traits in order to move advocacy along. I really, really have appreciated my time with you today, and I'd like to give my sincerest gratitude and thanks to, again, my fellow Illinois Council of Women and Girls Council member, Dr. Vidya Prakash, and the Alliance of Women in Medicine and Science at SIU Medicine. And thank you so much for all of you joining us today. Your participation speaks volumes. It actually tells me that you are intentional about really serving as a transformational leader in this advocacy work. And so, again, thank you so very much for being here, and I appreciate your time.
Ms. Richards, I cannot thank you enough for a very informative and inspiring session. I loved how interactive it was. I learned so much. I invite our participants in the next couple of minutes to use the Q&A and the chat for questions. I'm going to be vulnerable here in this safe space for a minute and share something that I just reflected on that I learned from you. And that's on the importance of knowing that cultural humility is a journey. It's lifelong. It's not a one and done. It's a process, and that it starts with self-reflection. And so in my clinic, I have lots of HIV patients, and I saw the name, I knocked on the door, I walked in, and I said, "Good morning, sir," and realized it was a transgender patient going from male to female, and realizing that I totally screwed up. And so our gut response is to beat ourselves up. And there's a lot of shame when we make these sorts of mistakes. But I reflected more and I realized, where was that coming from? I have a military background. So it's ingrained in me to call everybody ma'am and sir. So recognizing that piece of myself and how I interact with patients was important to maybe shift away from that, what my norm was. And also, it's all about the relationship with the patient as well. So being very apologetic, developing a new level of understanding with that patient and how they wanted to be called, and moving forward, we have a phenomenal relationship right now. And so we have a choice of either being rooted in our shame for the times that we do mess up, and we will, to really thinking of it as a process. And that's what I loved about what you just talked about, is that, you know, bias does not make us bad people. It's actually very normal to have bias. It's really understanding that about ourselves, and looking into our own values and how that translates to how we interact with others as a part of the journey. That's important. So I just wanted to thank you for that. That was a real aha moment and learning experience for me. We have a lot of thank you for the phenomenal talk, wonderful talk. Dr. Tucker, Natalie Tucker asked, what resources do you recommend to learn more about cultural humility and how to apply it in healthcare and healthcare leadership? And similarly, any further resources on transformational leadership?
I love that question. And I should have already put it into the chat, but I'm going to find a way to do this or email it out. But there is an amazing resource, and it's pretty lengthy, but it's such a great read. And it's from the Equity and Center, Awake, Awoke to Work. And it's basically a full-on step-by-step guide for people entering advocacy and transformational leadership at different stages of their lives. But it applies to the workspace. And yes, and it's so amazing. And again, I will send this out. It's from the Equity and Center Institute, and it's called Awake, Woke to Work. And you can actually probably Google it. Let me see here. I just pulled it up myself. And then basically it talks about, there's several sections of it. It talks about building a race equity culture, but also building equity culture within the healthcare system and educational system. And so I feel like this would be a great tool for many of our audience members here today to use. It's a really wonderful tool. And it also provides great examples for you to apply in your everyday practices.
Wonderful. Thank you so much again, Ms. Richards. Again, it's such an honor and a privilege to have you here with us and to work with you on the Council on Women and Girls. Again, it's been a most inspiring and enlightening hour. Thank you so much. Thank you for joining us.
Thank you all. This has been amazing. Have a great afternoon.
And so we're going to transition to our first 15-minute break. In this time, our Office of Continuing Professional Development will be emailing you a link to our networking session, which I strongly invite all of you to be a part of. Later today, we will kick that off at noon. And please be back by 10:15. We have a really exciting session featuring our local advocates through a session moderated by our own Dr. Stacy Satovia. And in the meanwhile, during your break, we invite you to watch the AWIMS video that was generated by Ms. Lydia House. And we had lots of volunteers from AWIMS talking about their personal roles in advocacy and how AWIMS has made them a better advocate and ally. So we'll see you back in about 15 minutes. All right, everybody, welcome back. I hope you enjoyed the video, and I hope you got to stretch and get a cup of coffee or a glass of water. We're really excited to have you back with us. I'm going to briefly share my slide to show our panelists. I hope everybody can see this. So thrilled to welcome you back to our panel discussion entitled Advocacy, Courage, and Persistence, Thoughts from Area Champions. And we have the great privilege of having Dr. Stacy Satovia moderate the discussion for us. Dr. Satovia is a medical director for the Office of Continuing Professional Development at SIU School of Medicine. She is also an associate professor of clinical medicine in the Department of Internal Medicine. She practices in Springfield, Illinois as a hospitalist with the Division of General Internal Medicine. Dr. Satovia, I'm going to hand it over to you to introduce our panelists, and I will stop sharing my screen as soon as you're ready for the discussion.
Great, thank you, Vidya. So I am really excited. We're going to hear some amazing stories from 5 incredible individuals. I'm going to pose some questions to them, and I think you're really going to get a sense for their contributions to our community and advocacy for a lot of the individuals that we serve as well. So I'm going to do quick introductions, and then we're just going to jump right into the questions. We have Erica Austin. You want to give a wave? Erica is the Deputy Director for SIU's Office of Community Care. The Office of Community Care's mission is to remove complex from complex care. The office supports programs that improve access, increase self-sufficiency, and increase healing for all. This is the home of our community health workers, our hotspotters, and trauma-informed care services and training. So welcome, Erica. Next, we have Dr. Susan Hingle. She's a professor of medicine, a general internist, the Associate Dean for Human and Organizational Potential, the Director of Professional Development for the Department of Internal Medicine. She is a celebrated educator and a local and national leader in gender equity and physician compensation and career advancement, and probably one of my most powerful mentors. So welcome. We're happy to have you, Dr. Hingle. Next, we have Heather Wetzel. Heather is Assistant to the Chair, Population Science and Policy. Heather is the 2021 National Rural Health Association Rural Health Fellow. She serves on the same board's Congress. She's a member of the local United Way Education Vision Council and the Illinois Critical Access Hospital Network Rural Health Fellowship Advisory Board. Really proud of the work that she does and thrilled to have you here with us. Thank you. And next we have Michael Phelan, who is the founder and executive director of The Outlet here in Springfield, Illinois. This is a local nonprofit agency that helps young males with the emotional, educational, and spiritual passage from boyhood to manhood. And that's a mission statement that really reflects the work that you do. So welcome. Thank you for joining us. And then we have Dr. Tracy Smith, who is the Director of Community Health and Programs at the Illinois Public Health Association, which is the oldest and largest public health association in Illinois, and is a leader in public health advocacy, health education, and promotion. Tracy is also instrumental to the creation and development of many of the community care initiatives that exist here at SIU School of Medicine, as that was her prior role. So welcome back, Tracy. Good. And I'm going to take the liberty of addressing all of our panelists who I have tremendous respect for by your first names, partly so that we can spend a lot of time with the questions and answers rather than me addressing you with lengthy titles. So if everybody's okay with that, that's what we will do. Great. So the first question I have is, and I think that this will really help the audience get to know what you're about. What is your go-to song that gets you ready for the work that you do? Erica, you want to go first?
Okay, so I'm a spiritual person, so my go-to song is "No Weapon Formed Against Me Shall Prosper." It's a song that is by Fred Hammond, and so if I'm getting ready for anything, anything that's gonna come my way, I just play that song. And gospel music really gets me, going and ready for the day.
And do you listen to this very loudly or softly?
Softly.
Nice.
Softly.
Good. Good. Michael, how about you? What's your go-to song?
Kind of similar to Miss Erica, just being a man of faith. There's a song by a guy named Trip Lee, which is a gospel artist or rapper. And it's a song called I'm Good. And it talks about whatever situation that you're in, you're still good. If you're up or down, if you're sad, you're good because God has your back and he's going to take you through any situation that you may go through. So, and it's very loud when I do have it on.
I love it. I can see you in your car.
Yes.
Heather, how about you?
My go-to song, there's a song called Stronger, and there's actually several versions by different artists. Kelly Clarkson and Britney Spears, have their own versions, and just about, what doesn't kill you makes you stronger, stand a little taller. But actually, Kanye West has a version too, and that's the one that I listen to, when I really need pumped up. So really loud and really inspiring.
I love it. Thank you. How about Tracy? Share your song with us.
So my song is Amazing Grace, and it has to be sang by Johnny Cash. And part of that is because my dad used to sing that song to us all the time when we were milking cows. And so it brings back my whole family's belief and just being connected with my family. And then Johnny Cash was my absolute favorite singer in the world. My dad used to have different folks that would live with us that needed homes, and they would help us on the farm. And there was one young gentleman I always thought was my brother. I never knew he wasn't until I was older because he'd lived with us forever. And he got me a Johnny Cash record every Christmas. And so that's why Amazing Grace by Johnny Cash is my favorite song in the world.
Thank you very much. Susan, how about you?
So I'm going to answer in a real internal medicine way. It depends. So if I'm needing to connect with the why of the work, I like the song Add to the Beauty by Sarah Groves, which really, reminds me of my purpose. If I'm struggling and need to get connected to motivation, there's a couple of songs. One is The Climb by Lauren Elena, and also Fight Song by Rachel Platten. And when things are going well and I'm feeling successful and ready to take on more, Who Runs the World by Beyonce.
I love it. Thank you for sharing. Now that we have a little glimpse into our panelists and how they spend their time driving into the work that they do, let's jump into some other questions. How about, I'd like to ask you, in the advocacy work that you do, what brings you joy? Michael, would you like to go first?
Sure. What brings me joy? So in the work that I do, again, we mentor young guys in the community. I think when a young man has been struggling or just going through situations, and kind of like the light bulb goes off, like, I got it. God does have a plan for me. I do have a future. I finally see what you, Mr. Mike, and the mentors and the team have been trying to tell me all along. So when that bulb goes off, it just melts my heart knowing that, wow, this guy gets it and he's on a better track now, because what the team has been pouring into him is really now beginning to kind of take flight. So that really gives me joy.
And the rest of your team, I'm sure.
Yes, because without that team, without them pouring into this young person, we couldn't do the work that we do. So I do have an amazing team also. A lot of times you just may see me in the paper, but I have an awesome team that they do a lot of the work with these young guys.
And that point resonates really nicely with what our speaker earlier had talked about is creating a team to do the work that you do. So,
Right.
great.
Very important.
Erica, how about you? What brings you joy in the work that you do?
I think it's similar to what Michael said, being able to help those in need, helping people gain a sense of independence and, get their life back on track if they've fallen off. I think a prime example of this was in the paper on Sunday on the front page where one of our CHWs was highlighted for the work that he's done in the community, specifically in Pillsbury area. There's a young man who he's been working with and trying to, find a different path or try to find different ways for him to do that and for him to speak on his, his path to where he is now. That gives me joy because it lets me know that, we're on the right path, that we're doing what we're supposed to do, and helping people see their own dignity, their worth and purpose in life. And so that brings me joy to see people, get back on their feet, no matter what they've been through, that they know that there's always a light at the end of the tunnel and that we're there to help them see that light.
Very powerful. Thank you, Erica. Sue, how about you?
I think it's kind of along the same lines. I mean, I loved the definition of advocacy, that it's any action that supports a cause and aims to influence decisions. And I feel like most of my advocacy work is really to try to make the environment better for patients, for learners, for my colleagues. And so my greatest joy is when I see them succeed, because then I realize that I've been able to break down some of the barriers that have been really inhibiting them from being able to reach their potential.
Thank you. Heather, would you like to share?
Yeah, any opportunity I have to serve in that support role and be supportive to the community, the people, causes, the issues that are impacting their daily lives. I was a support group leader for the Alzheimer's Association for 8 years. And, that was really powerful work, sitting even with just 4 or 5 caregivers at a time and listening. So that was their 1 hour a week to get away, where they felt that this was their, their therapy, they had this appointment, something that they had to do, and they were able to arrange for, we had adult daycare services provided for their spouses, suffering with Alzheimer's, but being able to listen, being able to help them advocate for issues and concerns that they have, not only for their loved ones, but for themselves. So being able to encourage them to be advocates for themselves, not just looking at the spouses that had the memory deficits, but also themselves, that, as a caregiver, that's often overlooked. So I am guilty of that as a mom too, I think. So, advocating for others to be their advocates.
Thank you. I think that all 5 of you have really provided some really tangible examples of how you've embraced advocacy. Clearly, you are propelling people forward. But this work is not without setbacks or not without challenges, for sure. Can you describe a situation in the work that you do where you had to embrace risk, and how did you navigate that situation? How about Sue? Can we go to you first?
Sure. This was a great question because it really caused me to reflect on a long career. And I'm going to use the example of something that really was one of my early entrees into advocacy, and it was during medical school. I was doing some work on the south side of Chicago and recognized this was pre-Affordable Care Act, which was upheld today. And so there were a lot of uninsured patients, and one of the populations that was really disadvantaged was pregnant women. And so with another medical student, we aimed to start a free clinic for pregnant women on the south side of Chicago. Had no idea how to do it, but we figured it out. We got in touch with people who could mentor us, and we ended up starting a free clinic for pregnant women. Got the hospital to allow us to for free have women deliver their babies in the hospital, and provide postnatal care as well. And this was the foundation of something that grew into multiple community service organizations, and now is an important part of Rush Medical School, called the Rush Community Service Initiatives Program. And it started just with a conversation with some people who were really struggling. So it was risky. It was hard, but it was definitely worthwhile.
Thank you. Michael, how about you?
I would have to say last September, I actually resigned from my full-time job at Lincoln Land Community College to take over, or to be the full-time executive director of the outlet, the first paid person on staff. So this is during a pandemic. I decided to leave a great career, and really, I believe, walk in what I know God has been calling me to do. I have been doing the outlet for 14 years, but always working other jobs, always helping other organizations. But when the pandemic hit, I really felt my families and the young men really needed someone to kind of help steer the ship. So just jumping in. And that's why I can kind of encourage anyone on this call is, if you feel that you're called to do a work, and if you feel that you are called to advocate and to start an organization, jump in with a plan and have a great team around you that can kind of help you and guide you through. So that's my risk taking, and I'm still living it now. Every day, it's such a joy to work with the young men that I, work with now.
Such a tremendous example. Thank you. Heather, how about you?
So this is a tough question for me because, vulnerability is not inside my comfort zone. I know there's a slogan that, change is good, you go first. So, risk is something that I'm pretty risk averse. But I did several years ago, volunteer to assist my local church. There was a particular population of this kind of at-risk youth that I knew needed a little bit of leadership and guidance. So not sure exactly how I was going to help, and I knew I'd hear some uncomfortable stories in that age group, of these teenagers, but knowing that, that they needed that assistance and guidance, and I wasn't sure where they would get it, or more concerned with the fact that they weren't. So that was a risk I was willing to take to be able to try to jump in there and help.
Yeah, thank you for sharing. As somebody who is relatively risk adverse, I understand that position as well. Tracy, how about you?
So I think I'm just the opposite. What was hard for me was to choose the riskiest thing I did, I guess, because I'm always taking a risk. I love risks. And I think that when I look back at it in the last few years, probably the risk starting the Enos Park project, the Access to Care project, was very risky to me. Not because it, to me, or to the residents or anything, because we knew it's what needed to be done. But I felt it was such a monumental stage as to where we were, with both hospitals coming together, health department coming together, making it part of the community health needs assessment, really calling it out. And I hadn't really did that like that program itself before, but oh yeah, I had in my mind, right? So it was a huge risk, and I knew it was more of a risk for everybody else, because I didn't want to let people down in starting that program and making sure that it was something that would actually allow individuals to receive the care, increase the access that was there. So that's probably the biggest risk that I was the most nervous about in the last few years. The rest of the risks just are always there. And that's kind of what makes me sleep at night, was what's the next big risk we can take. So
I love that perspective. And I love that you shared too that in your mind's eye, this had gone really well many times. And so we have to trust that, right? Erica, how about you?
I believe my biggest risk has been at SIU has been over the COVID-19 testing center. That was a huge risk. I have no clinical background, but I knew that we were at a time where people, that the community needed us. The community, needed a place to get tested. They were scared. They didn't know what to do. So I live by this motto: if not me, then who? And so I had to step up and do, the advocacy and fill in the gap where it was needed. And so I had to navigate that by learning more about COVID myself, learning from other doctors and clinicians to help me, as well as manage this operation site that was, not just for people who had symptoms, but for everyone. And, to date, that has been like the biggest risk that I have taken, because not only was I putting myself out there, but everyone else who had agreed to be with me. So, that was my biggest risk, but it was a great risk at the end of the day. We were there to help the clients or the patients that came to get tested, to calm their nerves, to give them advice, and to help them know that this is not the end. I know this, you came here, we're going to help you. And so that's been the biggest risk, but being able to do over 50,000 tests since last year has been tremendous. And knowing that I was a part of that risk, if not me, then who? So, yeah.
Well, and you're getting a lot of shout outs here in the chat for that great work that you did, Erica. Thank you. I've heard a couple of times in these responses, first of all, bold ideas. I'm seeing a lot of people with bold ideas, and you carried through. And I'm also sensing that you put yourself out there. And while this may seem like an odd question in the setting of such selfless work that you do, you've all demonstrated a really exceptional level of leadership. And leadership and accomplishment doesn't happen without promoting your ideas and yourself. So how can you tell us a little bit about how you would describe your role of self-promotion in the advocacy work that you do? So Tracy, can we start with you?
sorry, I had a picture in front of my mute button, and I'm not very IT very good at that stuff. So I think the biggest thing that I learned from a wonderful mentor I had at SIU was that either I'm at the table or I'm on the menu, and you always want to make the choice to be at the table. And so what that resulted in was trying to make as many meetings as I could to listen to what others were sharing and saying, offering to be on committees, offering to help lead different things when nobody else had the time. And I think just putting myself at a place where I could hear others and listen, and then raise those challenging questions. I think that's the biggest way that I kind of did that promotion, was to say, hey, I'm here to listen, and I will take back what you bring to me, and I will challenge. But that's not always a comfortable space to be in sometimes. And sometimes then trying to figure out how to have a group trust you to allow you into that space is a really huge step. And you have to put a lot of time and effort behind the scenes to make those relationships happen. So I do think in that process, though, it's very easy to lose track of your personal and your family time. And so, so I think that sometimes in self-promoting that way, I have to step back once in a while and remember to stay grounded too in who I am. So, but I would say that's the biggest thing, is that quote, that kind of mentoring statement to me is what I follow every day.
Yeah, thank you for sharing. Heather, how about you?
So I think as a woman, it's often not easy. And I know that this was, mentioned in one of our earlier talks this morning. So, to be our own self-advocates and self-promotion. So, but I've been very fortunate, as Tracy mentioned, to have great mentors along the way. I'm told I've had sharp elbows, kind of carve up to create my own ladder. And I think, advocating for myself, always doing that with the thought of advocating for others. So if it was, as similar to Erica, I don't have a healthcare background, but I've been at the school for 22 years. My first job was as a statistician for the Alzheimer's Center. So after working with the data on Alzheimer's disease and related disorders, seeing ways that I could take my caregiving skills and my background at SIU to work, as being a support group leader. So that took some convincing, I think, not only within SIU, but also within the Greater Illinois chapter of the Alzheimer's Association, to see how folks with different backgrounds can help. So, so using that pathway to advocate for myself while advocating for others.
But right, the self-promotion is in essence to do the work that you want to do, right? Wonderful. Erica, how about you?
For me, self-promotion, it comes because I guess for a lot of the clients and patients that I serve, we come from the same background. We have similar stories, similar upbringing, so I'm able to put myself in their shoes. And I think for me, I have to do it so people can see what I'm doing, because a lot of times I have to advocate myself to get positions because people look at me like I'm a little girl. They think, they don't know my age, or they think I'm too small, or my speech difficulty. So I have to put myself out there, and they're like, oh, well, yeah, she can do that. And so just putting myself out there so that people can know that I'm serious about the work that I do, but also that I can relate to those who I serve. That's the role of my self-promotion, to know that, I was here for a purpose, I'm here for a reason, and God gave me this gift to spread, and I have to put myself out there and not be selfless in it, but also to help others. So, yeah.
Thank you, Erica. Sue, how about you?
So I think some of the same principles. The American College of Physicians has long been known as an outstanding advocacy organization that has really positively impacted the profession of medicine for our patients predominantly. I got involved with the ACP early on in my career, but wanted to continue and wanted to have more impact. And so I had to step outside of my comfort zone because, like many others here, self-promotion is definitely uncomfortable for me. I do not like it whatsoever. But I learned through some important mentoring and some coaching that if you shift the view away from yourself and really keep the lens on what the goals are, that helps to improve the comfort level. And so I was able to really keep that focus when I ran for the chair of the Board of Governors and of the Board of Regents, and have continued to have that lens in trying to move that work forward.
Thank you. And you have certainly done an exceptional job in that work. Michael, how about you?
Yeah, well, I think coming from a single parent home, understanding some of the same things that my young men are going through, I also went through those same things. So it's easy for me to kind of keep that balance. But also, again, just being a man of faith, there's a scripture in Isaiah that is really, I think, what I try to live my life by, and even the outlet. And I'll read it. It says, learn to do right, seek justice, encourage the oppressed, defend the cause of the fatherless, and plead the case of the widow. And that verse, scripture, or whatever you want to call it, really keeps me balanced. I think it keeps my team balanced, knowing that these are marching orders, and it's not really coming from me, but we are just trying to stay in this lane.
Thank you. It's so wonderful to see how you are all motivated in a very personal way to do the work that you do. I'm going to ask you to be vulnerable once again and share your most meaningful failure and how you navigated that experience. You know, we all have these, and I think it's important for our audience to see how, you know, in the position that you're in now, how our failures have contributed to that. So, Erica, would you like to go first?
Sure. I actually just wrote about this in the revamp article. The Dr. Hingo asked me to write an article about this, about self-compassion. But my most meaningful failure, I believe, was when I was in a position and I left it because I was not happy. I was not happy, and I've never been in that predicament in my life. And so I left a job after 3 months, and that was just for me, it was like the ultimate failure. Like, you don't do that. I was really unhappy I was unhappy in that position, but I was unhappy that I left the job as well. I felt hopeless. I felt like, you know, nobody cared, and you know, I was usually the person who saved everyone. I was the person who saved everybody, but then I didn't have the strength to want to live at this point. It was, you know, I felt like I was drowning. But what I learned from that was I had to go through that. You know, so although it was a failure in my eyes, it was actually a setback for a come up. So and so I had to realize that, and I had to have self-compassion on myself to know that what I went through was for a reason. And although I couldn't see it at the time, it was preparing me for something much, much bigger. And so, you know, leaving that job, you know, helped me to see my passion, my true passion, which is true advocacy work, which is true community service, reaching everyone. But I had to realize my self-compassion as I was driving one day, and I had to accept that, you know, we're human, we make mistakes, and that's okay. But I learned that, you know, I had a purpose, and people go through things for a reason, and if you can make it out of it, you're great. And so one of the quote that I left in the article that I wrote is, what if the deepest disappointments that feel like the breaking of you are actually the making of you, a stronger, more beautiful you than you have ever imagined. So although I went through that, it broke me, but it made me better. So.
What an incredible example of growth. Thank you for sharing, Erica. Sue, how about you?
So I'm going to share one from my personal life rather than professional life, which was really life-changing. One of my sons had a really traumatic, horrific experience with the educational system, and I was not able to successfully advocate for him. And it resulted in us needing to seek alternative schooling, which took him and my husband out of our home for 3 years. And it was really, really challenging. But it has really helped me in a positive way recognize the need to really advocate for reforms in school. And so I'm really glad that Erica's on the school board now. So I've got another advocate there. And really a lot of navigating the experience was by, again, stepping out of my comfort zone, recognizing that I can't do it alone. It was a really challenging time in our lives, and without family support, without reaching out to my bosses at work and my colleagues at work for support, there's no way we would have successfully navigated it. And we did, and we are all back together and doing quite well.
Thank you, Sue, for sharing. And, you know, I'm reflecting on the way that I framed this question, and I think that this is an incredibly common question to ask people who have achieved so much. We ask this in the context of a failure, but this is not a personal failure in any way, right? It's maybe just a period of challenge. It's not related to a failure of our characters. And so I just want to maybe reframe this and ask it in the setting of a challenge. So Michael, how about you?
Challenges. Well, there's meaning when you're working with youth and especially young males. I would have to say, when a young male, when you've been working with them and really just mentoring and just a process moving along smoothly. And for some reason, either that young person still goes down the wrong path, be it prison or be it death. I would say, wow, since we've been around, maybe every summer we have 2 to 3 of our boys that I know that have either passed away or they go to prison. And that makes our team and me really kind of go back to the drawing board, which I think we should, just to make sure that we're doing things the right way. But also it plays on you. You know, what should I have done better? Or did we not meet with them more? Did we not give them more services? So that is a real challenge every summer, like clockwork. It happens. So just trying not to blame yourself and just realize at the end of the day, we're only there to guide these young men. We're only there to kind of give them tools, and it's their responsibility to kind of run with these tools. So as long as we're doing our job and providing resources, then we can rest in that. But it's still hard. From the mental side to just the cycle just continues. And this work isn't always easy, but I love it. So, yeah.
Thank you for sharing. And I think that certainly in your example and Sue's example as well, even though you may not outwardly see the signs of the work that you did, I'm sure that in moments of reflection, the people that you have touched are deeply appreciative. I'm convinced of that. So Heather, would you like to share?
I think we miss the signs that we don't want to see. And I am often, well, 99% of the time, so I'll say always tunnel vision. I'm always working, you know, work. And don't take much time, you know, for the personal side. So one of my biggest failures over the last few years was I had a coworker who I didn't realize was struggling until I just, you know, saw something slip, and then, you know, something else, something very minor. And then once I took the time to talk to her, to listen more of what was going on at home with her husband, who was in his early 80s and was having had a ton of signs of cognitive impairment, plus was also combative, and just a ton of behavioral issues. And so, you know, thinking about so much of what happens outside the work setting, and so needing to step back and think, not so much, you know, focusing on work, but stop and take a pause. So we do have breaks. So take those breaks. If COVID's taught us one thing, you know, it's you know, to step back and try to take that time. So, you know, my most meaningful failure, I think, was almost missing that opportunity to engage with her and see what I could do to help in that situation and be able to provide, you know, that advocacy for her, to get her husband in, to see a physician, to give her some help, and to go from there. So, yeah.
Very nice example. I think you're all sharing elements of resiliency too, and demonstrating the grace that you've extended yourselves in these situations. Tracy, how about you?
So I really struggle a lot with imposter syndrome because I often don't see what I do in a leadership style, or I think that I struggle with that. And so I think that's probably a lot what has led to some of my bigger failures. And I think that led down to probably one of the biggest ones that I recognize is that I often will let others try to tell me where my gaps are or what kind of team I need to build around me instead of building the team that I know that I need and really directing that next hire as part of the team. And so I think that that is probably one of the bigger failures when I look back over the last few years, is allowing someone else to try to direct me as to what was needed for the team that I was building and not listening to where my gut said that we needed. So, and I think that comes from an imposter syndrome for me a lot of times, is that I'm looking for that person to say, you have gaps and we need to fill this or we need to address that. And I struggle with that.
Yeah, thank you, as many of us do. And, you know, we're going to rephrase that, Tracy, as the imposter phenomenon rather than syndrome. That is not a pathological process. It's normal human. It's a normal human experience. So thank you for sharing that, as I'm sure a lot of people in our audience that resonates with them. So speaking of resiliency, how did the pandemic change the advocacy work that you do? Give us a few examples. So Michael, would you like to go first?
Sure. Well, we did like a deeper dive in what we're doing. We actually brought on a consultant that we won a grant through a program, and we just kind of dissect the entire program to make sure that we're not just doing things just to be doing them, and that we are more data driven and not just, like a lot of times with mentoring, it is so emotional and relational, and that's great, but is it working? Is it really having the impact? So we just kind of dissected our entire program, and that has been really, really great to kind of see where we're great at and then where we suck at. And we're trying to really focus on the areas that we are really struggling in. And I think that has been the best thing that we've done in the past 15 months, is really focus on our weaknesses, because that's really going to make our program and our organization strong.
Excellent example. Tracy, how about you?
So COVID gave me the chance to look at where I was in my career and step out and take a new chance to expand my career in policy direction, which I, moved myself out of a very comfortable space I was in for almost 25 years at the School of Medicine. And I think COVID kind of gave me that nudge. And what it has allowed us to do, which was what my goal was all along, was for us to start to work with community-based organizations that have not had a chance to build the infrastructure they needed to have in place to continue to provide the services they need, whether that was FISCO, whether that was management, whether that was staffing, being able to allow them to build that infrastructure so they can then start to apply for funding and grants. So it's not just going to larger institutions to do that work. So that was a gap I'd seen for years. And the way COVID funding and just the awareness that came from that, it allowed me to move into that direction. And so that's what I'm really excited about. And I feel that as a public health structure in the state of Illinois, we're going to come out so much better on the other end of this because we're building an infrastructure, and that's what we had to do. So while COVID has been a very difficult time, it's been a very empowering time that we can capture and build on that to develop that infrastructure so that we can help where we need to help going forward.
Thank you, Tracy. Heather, how about you?
I think if it's taught one thing, is that it's okay to not be okay. And there's so many conversations since the pandemic on mental health and mental and behavioral health and the intersection. So I think it's been a great opportunity to have that conversation, whether it's within the Alzheimer's support group setting, or I serve on the United Way Education Vision Council. So talking to the different groups who are working with our community's youth and their summer meals programs and their summer education programs, and back to school, and now being out of school for the summer. being okay with not being okay, and trying to flip the narrative and see how we can improve that with these communities. And it's not status quo, and it's not, okay, we're in year 7 of a 10-year grant and we've done it this way for 7 years. This is how we're going to continue to do it. You know, meals will only be in person. Well, that didn't work for a year. So we had to figure out how to be able to deliver to make this delivery, you know, at home. Not only, you know, nutrition, but also for content, but different ways to get out there and reach our communities. Our community health worker program is just one of many great examples of that.
Thank you, Heather. You've been busy. Sue, how about you?
So I think, as you know, Stacy, when the pandemic hit, CHOP was still very, very new. We were barely a year old. And the pandemic really offered a proof of concept for CHOP, which is really focused on not only individual but organizational well-being and development, with the goal of everyone being able to reach their full potential. And the pandemic really heightened the need for all of the work of CHOP because of, I mean, it was just, there were so many incredible challenges to individual well-being, to organizational well-being. People were doing things totally different than they had ever done them before. So there was a huge need for professional development. And so, I mean, the work that a very small team, including yourself, did is extraordinary. I mean, it's really amazing what happened in that 1 year time. I also think that, as has been pointed out a couple times in the conference today, the inequities in our world were really amplified during the pandemic. And so the work that I do external to SIU was also really heightened. The need was just so much more obvious and urgent. So it really ignited a lot of important advocacy work through the ACP and through the AMA and through AMWA that hopefully will help us get to a better place and a more inclusive, equitable, and just world.
Thank you, Sue. Erica, how about you?
So I think people tend to cater to areas that they are familiar with. You know, I'm East Side, so I know all about that. But I think the pandemic changed that. The pandemic helped me to get out and hit all of the territories. And so I was able to see firsthand what was needed, what was lacking, and as been said, the inequities that, that cast a bright light on that. And so since I was able to see firsthand what was needed, and whether that was COVID, people not getting COVID vaccinations for whatever reason, hesitancy. I was able to see the homeless population. I spent a lot of time at Salvation Army, a lot of time, and I was able to see firsthand what was actually happening. So for me, although I knew it, I actually got a chance to see it firsthand with my own eyes. And so I began to think of different ideas on how I could combat that. I have ideas right now. I know we're getting past COVID, but we still have some inequities that I see firsthand. So I have some ideas that I've been proposing and sending people to look at, see what they think about that. One is addressing the homeless population. One is maybe getting community health workers who are at a younger age, a youth community health program, so that they can be well versed in what's going on as well, because they need to start at a young age as well. And so also what changed with me was I had to be a leader. I had to step up and put my face out there. And I'm kind of like a shy person, but I had to put myself out there. And one of those things, the way I did that was with the vaccination. I was very, very hesitant in doing that myself. Very, very hesitant. But I knew it had to be done. And so when I did it and I had the video recorded, I had a lot of people inbox me and say, hey, if it wasn't for your video, we wouldn't have got this done, or if it wasn't, so I had to put myself out there as the advocate that say, hey, if I can do it, you can do it too. And so it's just, for me, it was just putting myself out there more, how the pandemic changed it, but also bringing to light in my own eyes to see firsthand what was really happening. And not just in the east side of Springfield, but everywhere. I had to touch every ground. And so being present and knowing what was going on, that really changed it.
Thank you, Erica. I know you inspired a lot of people during that time. It sounds like the pandemic certainly strengthened and expanded your advocacy roles, and how refreshing, because the media and society would lead us to think that we contracted a lot, but what I heard was a whole lot of expansion, and that's just really fantastic. We do have a question from Nicole. She, first of all, says, thank you for all of your vulnerability. Her question is, with all this beautiful advocacy and outreach that you do, how do you manage the work-life balance of wanting to become involved and a leader, but also wanting to be present with your family? So I think that as successful as all of you have been in your personal and professional lives, answering this question will probably be our last one, but a chance to maybe inspire those who are watching and listening. So Heather, would you like to go first? Or I can toss it out, whoever would like to answer the question.
This is so hard, because I think it is, right? With COVID, as we pivoted to working from home, and I'm working from home today, right? Work life is the same thing, right? There is no slash in between. It tended to blend together, at least for quite a while. I set goals for myself in terms of spending time. I block out time to make sure that I spend with my family. My girls are 18 and 22, so in some aspects they don't need me as much as they used to, but in other ways they need me more. So so trying to balance that, and definitely shutting off, unplugging, and I think it helps me refresh to do better the next day. But I'm definitely not great at it by any means.
Tracy, how about you?
I struggled with this for a few years, and then about 2 years ago, I made a decision that I was going to take this head on and defeat it. So I actually moved so I could decrease my time in the car. I was spending 2 hours in the car a day driving back and forth, and I went down to 18 minutes in the car, which is so awesome. I also now am very strict about the time that I start in the morning and the time that I end at night. I also have been very focused on training and mentoring the next group to step in to fill some of the commitments that I used to feel that I have to make. And so really identifying individuals I'm working with and then bringing them along and then moving myself out of the picture so that they can take on those roles, I think is really critical. And then I unplug my phone. I do not do social media. And I think that allows me then to focus most of my time on my family and not on maybe what other things might be distracting me. So like I said, the last 2 years have been very, very direct in making sure that I am doing those things, because as my kids age and I age, the life just gets shorter, and we have to make that a focus. And I think I found that to make me a better writer, developer, and advocate itself, because I'm very happy. So I think that that's really critical.
Thank you, Tracy. Erica, how about you?
Boundaries. And as Heather stated, it's a work in progress. I'm not perfect, but I do stick by my calendar. And I have an accountability system, and my friends are a big part of that. I have work colleagues who are a big part of that. The biggest one is my mom, and she's always telling me, like, you can't help others if you're running around ragged. And so, she's always in my ear, like, you need to calm down, you need to slow down, take time out for yourself. And so, You can't help nobody else if you're burnt out. And so it took some years to get to this point, but I feel like I do have a handle on the balance of the calendar and know what's in there, not taking no more what I know I can't do, balancing everything I have to do, but also my accountability system is a big one, and my mom being the number one.
I love it. Michael, how about you?
Well, still a work in progress as everyone else. I have a 9-year-old and a 10-year-old, and a wife. So my family life isn't where I want it to be, just time-wise. So I try to take advantage of those times, if it's going to my daughter's dance or making sure my son is playing basketball, or trying to make sure I have time with my wife for dinner, or just taking her out to eat. So again, I'm working on being better in that, but also I ride bikes, I cycle. So I try to make sure at least once a month I'm out of the state or out of the city and just kind of regrouping, getting myself together. Kind of like Miss Erica said, if you're worn out, if you are always giving, you're going to dry up. You're going to burn out. So I think in this type of work that we do, it is easy to get burned out. So just balance, grace, forgiveness, and getting back on the horse.
And our families extend a lot of that to us as well.
Yes.
Right. Sue, how about you?
So I think one of the things that I've done is try to get rid of the concept of balance, because that's always indicating that everything's equal, and tried to really internalize the concept of work-life harmony and integration. And I think that there are times when you can definitely integrate family life into some of the professional aspects, and there's very positive things for the family that comes out of that integration. I also think that flexibility has been key, and reflection. And that fits with the harmony piece. I mean, you kind of know when you're not in harmony if you take the time to reflect. And so I think there's a lot of little things that we can do that can help to facilitate that. It's really blocking out time for reflection. I think it's practicing gratitude, and perhaps reminding people around you to also practice gratitude, because that sort of integrates into the harmony piece. And I think those little things really definitely can add up. And I'm definitely, like everyone else, a work in progress, and there are times when it's totally out of control. And I experienced that not too long ago when I was having really severe palpitations and tachycardia, and recognized that was my body's warning sign to me that things were not where they should be. And so I have started integrating daily meditation in the morning and in the evenings that have really helped to not only make me physically feel better, but also emotionally and spiritually feel better as well. So I think there's a lot of little things that we can do that are related to harmony, integration, flexibility, and reflection.
Thank you, Sue, very much. And we have 1 more minute left. And so I just want to take the chance or the opportunity to thank each of you for sharing your vulnerabilities, for sharing your fight songs, and for inspiring those who are with us today. From the bottom of my heart, I can't express, I feel like I was in a very privileged position just to ask you these questions and to hear your responses. It was just a real joy. So Vidya, I'll turn it back over to you.
Dr. Satovia, thank you so much for moderating a truly phenomenal discussion with some amazing advocates and leaders. I know I am taking away a lot of pearls from this discussion, including the concept of work-life harmony, moving away from balance to harmony. The if not me, then who? I love that, Erica. Michael seeing advocacy as a calling and jumping right in with a great team. And then looking to vulnerability. Heather and Tracy, you commented on this so eloquently, where it is indeed okay to not be okay, and call in for help. And reflecting on imposter phenomenon, Tracy, I am a fellow imposter with you and struggle with this a lot. So just so many pearls, so much wisdom. Thank you so much. Before we head into the break, please everybody stay with us. We're going to have a brief AWIMS award ceremony. And I'm going to turn it over to Dr. Susan Hingle, who led the awards committee this year. She will be presenting the AWIMS Awards and the Founders Award. And I'm going to have our Office of Continuing Professional Development share the slides. So please stay with us until the break.
All right, so thank you all for sticking around for this. This is really building on this morning, and I'm so excited to have this opportunity to celebrate AWIMS and many of the people who make up AWIMS. So next slide. So you can see on this slide what the purpose of the AWIMS Award is. It is an annual award that recognizes anyone from within the School of Medicine of any gender, and you'll see we had some phenomenal nominees this year. And this is an award to recognize the people who exemplify the core tenets of the AWIMS mission. And you can see those core tenets. They are promoting positive change. As you can see, I have visual difficulties. Promoting positive change in the realm of gender equity, championing professional development and career advancement for women in medicine and science, supporting efforts to improve work-life integration for all members of the medical community, and a commitment to service to the community. So there's a lot of different things that fit the mission of the School of Medicine as well as AWIMS that our nominees exemplify. So these are we're gonna recognize each of our 10 nominees this year. And we're not only gonna recognize the nominees, but we're also gonna recognize the nominators, because you two are really an important part of our community. So if you can click the first nominee, is Lydia Arbogast. She is from Carbondale. She was nominated by Prima Narayanan, Buffy Ellsworth, and Buck Hales. Congratulations, Dr. Arbogast. Next nominee, Sacharitha Bowers, who is from the Department of Internal Medicine and Division of Dermatology, who was nominated by Carolyn Pointer from Medical Humanities. Congratulations, Sacharitha Bowers. Next nominee is Kariana Brenham, who was nominated by a bunch of people from the Family and Community Medicine Department, including Mega Manick, Ashley Howard, Christina Smith, Lori Lopp, Nicole Marocha, and Sarah Hutching. Congratulations, Kariana. Next nominee is Paige Crawford, who is not a physician. She is a member of our clinical workforce, and she was nominated by Lydia Churchill, another great nominee. Congratulations, Paige. Next nominee is Mito Zhuang from our Department of Emergency Medicine. She was nominated by Jennifer Rosario, also from Emergency Medicine. Congratulations, Mito. Next nominee, Catherine Hild Mosley from our Department of Obstetrics and Gynecology, who was nominated by someone from the Department of Urology, Mary Hitt. Congratulations, Kathy. Next nominee is Nicole Marocha from the Department of Family and Community Medicine, who was nominated by Megan Golden, who heads up our Trauma Recovery Center. So Nicole was both a nominator and a nominee. So thank you and congratulations. Next nominee is Janet Patterson from our Department of Pediatrics, who was nominated by Meredith Voley and Anna Hickey from Pediatrics. Congratulations, Janet. Next nominee is Robert Robinson from the Department of Internal Medicine, and he was nominated by Hee Young Han from our Department of Medical Education. Congratulations, Robert. And our final nominee was Mary Stewart, who is our Chief Operating Officer. And she was nominated by Michelle Kiefer, Andrea Muma, Tia Wessel, and Lisa Mueller. So I think this is really a phenomenal group of nominees. I think it really demonstrates that the work of AWIMS is very, very impactful and very, very successful, that we have so many people from across the organization, faculty, staff, multiple departments, men, women. I think it really highlights that the AWIMS work has been very successful and impactful. So congratulations to all of our nominees. Next slide. This is a picture of all of them except for one. We were unable to get a picture of Paige, but this is our illustrious group. And next slide. We had a very difficult time selecting people to be recognized because everyone was outstanding and has made so many important contributions to our community. However, we did end up coming up with the 2021 SIU Medicine AWIMS Award recipients, and those are, if you can click, Kariana Brenham and Mito Zhuang. And I'm going to quickly read a little bit from their nominating letters. Dr. Zhuang is going to be recognized because of her contributions to mentorship and advocacy. So Dr. Zhuang feels very strongly it is important to mentor her junior faculty, residents, and medical students to help educate them about the challenges faced as a female physician. She is a true female physician leader. She is a busy physician caring for a vulnerable population of patients in the emergency room. However, in addition to these clinical duties, she, in an outstanding manner, teaches residents, medical students, and advanced practice providers at the bedside. So she is someone who really exemplifies all of the missions of the School of Medicine. And Kariana Brenham, a couple of things to pull out of her nominating letters is for one of the people who nominated her, I thought this was a very telling statement. My choice to continue my education with SIU Medicine as a resident is one I will always be thankful for making, and it is because of Dr. Kariana Brenham. Another one of her nominators talks about the impact that she has had on her personally. On a personal note, it was Kariana who encouraged me to further my career and reach for the stars. With Kariana's support and encouragement, as a single mother, I have completed my bachelor's degree and am currently working on my MBA with a focus in healthcare administration. And then also fitting with that individualized and important attention and impact, Kariana worked with me during my pregnancy during the COVID pandemic to help decrease exposure. She made sure the health and safety of her physician colleagues was important and always volunteered to work extra. Kariana is able to face difficult situations with great ease. And so I would like to congratulate both Dr. Kariana Brenham and Dr. Mito Zhuang for receiving the 2021 SIU Medicine AWIMS Awards. Next slide. And next slide. So we have a special celebration today. Next slide. So we are giving our first AWIMS Founders Award, and this is for championing professional development and career advancement for women in medicine and science, for promoting positive change in the realm of gender equity, and for commitment and service to SIU Medicine and AWIMS. Next slide. And you can click again. When we are recognizing Dr. Hilary Sanfie. Dr. Sanfie recently retired, and we miss her already. She is a professor of surgery. She was the vice chair for educational affairs for the Department of Surgery at SIU. She has a really extensive CV and list of recognitions, but a couple of things that I wanted to point out related to sort of the goals of AWIMS and her impact on AWIMS. So Dr. Sanfie was the first woman in Ireland to complete her higher surgical training in general surgery. She was the first woman to be appointed as a consulate general surgeon in Scotland. She was the first woman to be promoted to tenured professor in the Department of Surgery at the University of Virginia. It goes on, and she, I know, had a very significant impact on initiating this conference and on AWIMS, and I'd like to turn the microphone over to Dr. Prakash for a couple of words related to Dr. Sanfie's impact.
Thank you so much, Dr. Hingle. And I would really like to congratulate Dr. Brenham and Dr. Duong for being the recipients of the AWIMS Award. So well deserved, and so excited about our very phenomenal nominees as well. And many, many congratulations. I'm just delighted to hand over the Founders Award to Dr. Sanfie. Many of you may not know that this conference would never have come to life had it not been for Dr. Sanfie's vision. She was the one who approached me 5 years ago and said, hey, I've heard of these women in surgery conferences. Why don't we bring a Women in Medicine and Science Professional Development Conference to SIU? And that's really what prompted a group of very committed individuals, as you see with our conference planning committee, to start the first conference and, led to subsequent conferences. And I will say, on a personal sort of mentorship level, I love to share this story about Dr. Sanfie. I once went into her office extremely frustrated about something that had happened. And I sat down and I had kind of a mini meltdown where I was raising my voice. I was very upset. And I remember her calm, cool, collected demeanor and how kind she was to just listen with such grace and such compassion, and really got me through that event. And I left her office feeling that everything would be okay. And so just on a personal note, thank you, Dr. Sanfie, for being my sounding board, for being such a phenomenal mentor and role model. This is so well deserved. And I would like to hand it over to Dr. Sanfie and to Dr. Duong and Dr. Brenham to say a few words. Dr. Sanfie, we'll start with you.
Dr. Prakash, thank you so much. And thank you for my award, which Dr. Hingle presented to me a few days ago. I'm just sorry we can't be there in person. I think you give me way too much credit for what AWIMS has accomplished. I may have thrown out the seed, but not only did you run with it, you galloped with it. I mean, AWIMS is so much more than this conference, and I would encourage all of the attendees to go to the website and look at the breadth of what has been accomplished by AWIMS under Vidya's leadership, but of course, there are so many others, as you mentioned, who have been involved. And the conference this morning has been phenomenal. I have learned a lot, and I certainly look forward to the next one and staying involved. As you mentioned, I have retired. I am still in Springfield, and I'm hoping I'll probably be here for a while longer, so I hope I'll still be able to stay involved. And congratulations also to Dr. Dong and to Dr. Brenham. I'm just humbled to be in your company. And thank you again to all.
Thank you so much again, Dr. Sanfie. Dr. Brenham, Dr. Duong, would one of you like to share some words, some thoughts?
Sure, I can go to. So I was so honored to get this award, and for all of those
wonderful, amazing women in my office, from our residents to my partners, to our wonderful now COO, that wrote those letters for me. I was so honored. They've all been such influential presence in my life to help me be the person that I am here at SIU. And I have so many amazing mentors, and most of you that are on the conference and that have planned this have been amazing mentors to myself too. I've had the opportunity to work with Dr. Sanfi, Dr. Duong, on committees for the medical school and for SIU as a whole. And I'm just honored and just have learned so much from all of you, and you've all been such a great support. SIU is a wonderful place to be, and wonderful in the support that I feel that it's given myself and other women and physicians as a whole. I was lucky enough to have been here for medical school residency, and then continued my career as faculty, and I'm just so humbled to get such an amazing award from all of you. So thank you so much. I really appreciate it, and I'm happy to be here today.
Wonderful. Thank you, Dr. Brenham. Dr. Duong?
I would echo everything that Kariana has just said. I would say that, oh, I didn't realize that was my background. I would say that I was floored, surprised, speechless when I received the email. I wasn't even aware I was nominated, but I am so honored to have been considered, and even more astonished that such a panel of highly respected group had supported me in receiving the award. It means a lot, and hopefully I can represent all that the award is meant to, I guess, represent. So thank you so much.
And thank you, Dr. Duong, Dr. Brenham, and Dr. Sanfi. What a privilege to know you and call you my colleagues and people that I look up to and learn from. Such a well-deserved honor. And again, just so proud, and many congratulations. And many thanks to Dr. Hingle for leading the awards committee this year. It was through her relentless emails and her own advocacy that we were able to draw in so many wonderful nominees. So many thanks to her and to our entire committee. So we're going to take a brief break until noon. Laura Worrell and Jennifer Coyle have emailed all of our participants a special link to the networking session, which starts at noon. So take a break, grab some lunch, and please join us back at noon. And we hope to start a discussion at the larger level and then break out into smaller groups. And we will end with the raffle, so be sure to join us. Thank you all so much for joining us this morning. We look forward to connecting again in about half an hour.